Pronto.
ಮಾತಾಡ್ತೇನೆ ಅದನ್ನು
ಇದು ನಮ್ದು ಮೀಟಿಂಗ್ ಒಂದು ನಡೆದು ಸರ್.
ಹಲೋ
Good morning. Good morning, sir.
Good morning, sir.
नहीं ऑन करो
Now, thank you, dignitaries. Now we would like to welcome our esteemed dignitaries by presenting mementos as a token of love and gratitude. May I kindly request Professor Abdul Nasir Ansari, sir, Director in Charge, National Institute of Unani Medicine, to kindly come forward to present mementos. Sir, may I kindly request you to present a memento to Professor John Kumar Mishra, sir. Thank you, sir. Sir, may I also request you to present a memento to Sri Unani, sir. May I request Dr. Mrs. P.A. Bhatt, sir, to kindly present a memento to Dr. Kasuba Upadhyay, sir. Dr. Kasuba Upadhyay, sir, may I kindly request you to come forward and to kindly present a memento to Professor Sri Rajiv Vasavan, sir, CEO, Ayurveda. Now, may I kindly request Dr. Devashish Pandey, sir, Joint Advisor, Ministry of Ayush, to kindly present a memento to Dr. P. Shishidharan Nair, sir. Next, may I kindly request Dr. Kusum Sapa Madam, Research Officer, Ministry of Ayush, to kindly present a memento to Sri Sukesh Kumar, sir. May I kindly request Professor Abdul Nasir Ansari, sir, to present a memento to Dr. Mukul Patel, sir. Sir, I also kindly request you to present a memento to Narayan Gambhir, sir. Next, I would like to present I kindly request I kindly May I request Musaf sir clear. Thank you, thank you, sir. Thank you, sir. Thanks to all the dignitaries. Ladies and gentlemen, it's my privilege to invite Professor Abdul Nasir Ansari, sir, Director in Charge, National Institute of Unani Medicine, Bangalore. Sir is a renowned expert in Unani regimental therapy. He has been providing unwavering support to our institute and brings innovative approaches to his work which exceeds expectations. With his sharp insight, he has earned admirations from both patients and students. He is constantly striving for excellence and inspiring those around him. May I kindly request Dr. Abdul Nasir Ansari, sir, to deliver the welcome speech.
Thank you. So, good morning, everyone. So, there's a lot of echo. Hello. There's a lot of echo. Okay. पार्टिसिपेंट्स को भी सुनाई देना है जी नहीं जाएगी हेलो Hello. Yes, I think it's better now. Thank you. So, respected members of the core group of experts, representatives of general insurance companies, Ayush hospital owners from states of Karnataka, Andhra Pradesh, and Telangana, government officials from these three southern states, officials of Insurance Regulatory and Development Authority of India, General Insurance Council, Insurance Information Bureau of India, working teams of NIUM, dear colleagues, ladies and gentlemen. I feel immensely proud and delighted to welcome you all to this sensitization program for empanelment of Ayush hospitals for insurance coverage for Ayush stakeholders and government officials. I also welcome you to the immensely pleasant weather of Bangalore, a much needed respite. When most parts of India are reeling under relentless onslaught of heat waves, Bangalore bears the breathing space for all of you. I'm also indebted to Ministry of Ayush for selecting NIM as a hub for this brainstorming program. Ladies and gentlemen, we all understand that there has been a tremendous demand of Ayush treatment, especially since the last decade. The Ministry of Ayush has done a remarkable job in popularizing the Ayush therapies, notably during COVID-19 period. Patients are preferring more and more of Ayush therapies for a variety of chronic intractable diseases, especially lifestyle disorders such as hypertension, diabetes, obesity, cervical spondylosis, chronic low backache, stroke disabilities, etc. Several Ayush hospitals have developed packages for various therapies used in specific diseases. Considering the growing demand for Ayush treatment, Insurance Regulatory and Development Authority of India has recently advised all insurers to provide Ayush coverage. Empanelment of Ayush hospitals, therefore, becomes an important aspect in ensuring Ayush insurance coverage. This program will guide us through to the empanelment of Ayush hospitals in Rohini platform to ensure the visibility of Ayush hospitals in the insurance sector. This sensitization program will serve as a platform for insightful discussions, knowledge exchange, and networking opportunities between representatives from general insurance companies and key stakeholders from the Ayush sectors. The program will have interactive sessions designed to elucidate the benefits and intricacies of integrating Ayush treatments into insurance coverage. Presentations will be held on various topics like prerequisite for empanelment of Ayush hospital under insurance, how to enroll under Rohini platform, complaint redressal mechanism for insurance sector, panel discussions, how to prepare the documents required for insurance claims, procedures for documentation and settlement of insurance claims. Finally, brainstorming session between the learned scholars of insurance and Ayush will make this program more knowledgeable and fruitful. I sincerely hope that this sensitization program at ANIM Bangalore will mark the beginning of insurance era in the history of Ayush sector. Thank you very much.
Thank you, sir. Thank you, sir. Next, it's my honor to extend an invitation to Professor Gulamuddin Sufi, sir, Head of the Department of Pharmacology, Ilmul Agbiya, to deliver a presentation on the overview of our hospital. Professor Sufi sir's profound expertise and versatile knowledge in the field of Unani medicine makes his insights invaluable. Sir, we are eager to hear from you about the advancement and achievements of our institution. Over to you, sir.
Namaste and good morning to all of you present here on the dais and below the dais. Since we are going a bit late, so formally I would thank all the dignitaries who have come over here for this sensitization program. And for me, I thank my director who has given me the opportunity to introduce NIUM Unani Medicine at this occasion. I feel because of this diverse group here from Ayurveda, from insurance, and from Unani, and from other streams, it is better to have information about what Unani is all about, its origin, and what the disease treatment and advantages and limitations, just in 1 minute. So it has been one of the oldest traditional systems of medicine and has global intent in the past and in the present also. And it is based on 7 basic principles we call Umur al-Tabaya, without which no living thing can exist. And there are essential causation for sustaining health and restoring health. I am deliberately not including the disease because disease is an abnormal thing and the normal thing is health. And if it is not there, we have to restore it. So Unani medicine usually thinks of health as a positive aspect, not the mere absence of disease. And then we have an elaborate classification of disease. We have elaborate scheme of diagnosing the disease. We have treatment strategy and managements are derived from above principles and nature of causation. The individual is studied as a whole, and disease is looked at from a holistic perspective with treatment individualized according to unbalanced mizaj or body constitution. In Ayurveda, we call it Prakriti. The system is health promotive as well as curative, at the same time addressing body, mind, and soul. Presently, the thrust is to generate normative evidence for its claims and standardized treatment guidelines, which we have almost well established now. Standard treatment guidelines, they have been published also, and standard procedures, which are also almost complete. Introducing NIUM, this institute was established in 1984, but formal activities started from 2004. It was our proud moment that Shrimati Sushma Swaraj, the then Union Minister of Health and Family Welfare, Government of India, inaugurated the institute on 20th December 2003. The vision of the institute is to strengthen and promote excellence in education, research, and patient care in Unani medicine. And its mission is to impart quality education of Unani medicine, to carry out research in Unani medicine, to provide efficacious, safe, and cost-effective health care solutions through creative application of Unani medicine. Objectives from the mission, we have developed these objectives to develop, and we are on the path of these objectives to develop the institute as an apex institute of national and international standards. To promote the growth and development of Unani medicine, to undertake research in various disciplines of Unani medicine, and provide training in teaching and research at PG level. To produce postgraduates in all the subjects of Unani medicine, to conduct experiments and develop patterns of teaching postgraduate education in all subjects of Unani medicine, to provide medical care through Unani system of medicine to the suffering humanity. Basically, when we see the infrastructure, I hope all have visited our hospital. It had been carried through various phases. We are in phase 4. We have an administrative block, academic block, hospital. There are extension of hospitals also. Then we have a library, pharmacy, and boys hostel. In phase 2, We constructed staff quarters, guest house, girls hostel, indoor games hall, and health huts. Basically, the idea of health huts was to promote medical tourism. Phase third, we developed our regional therapy, which has been the pivotal in promoting Unani system of medicine. And we have hammam, auditorium, canteen, and extension of pharmacy. In phase 4, we have boys and girls hostels. Some more health huts have come up, and staff quarters of 3, 4, and 5 are being constructed. In academic activities, when PG is concerned, we have, in 2004, we had 4 departments. And in 2012, we had Kulliyat Umur Tabiya, principles of basic medicine or Unani medicine. And 2014, we have Alaj bil Tadbir and Jarahat. And in 1819, we got Amraj Jild with Tanziniyat, cosmetics, and dermatology, and Maitul Amraj, pathology. Details of admission, we had till date 822 admissions of students here. Among them, 390 were girl students and 432 boy students. And there's a particular trend from 2017 that empowerment of women is seen clearly here. And we are getting this admissions, more and more admissions, because our departments have extended. In PhD academics, we are fortunate that we have now opened up this PhD programs here in 2 departments, and LIC has been conducted for other PhD in other departments also. But at this time, we are running our 2 programs in medicine and Ilmul Adwiya, pharmacology, from 2014. Almost 12 students have completed their PhD here. Research and publication, we have published 638 dissertations, 1,983 research papers, and 70 books have been published. And we are publishing regularly 2 journals, one in English, Journal of Research in Unani Medicine, in collaboration with Medicno. It is now online. And we have Ayush Care listed Urdu journal, Tarjaman Tib. And we are also publishing our newsletter here. So, about the hospital, we are fortunate that ours was the first NABH accredited Unani hospital. It was accredited in 2017 and renewed subsequently in 2021. We have NABL accredited laboratories. First time it was accredited in 2021, and subsequently it was renewed in 2024. In patient care, I hope all the participants visited our hospital. We have OPD and IPD wings, diagnostic laboratory, pathology, biochemistry, and radiology. We have regimental therapy unit, wherein we go for almost 14 procedures in regimental therapy. And we have associated physiotherapy unit with regimental therapy. And we have a full-fledged pharmacy. And there are somewhat 40 instruments. And we are developing various dosage forms, from tablets to classical decoctions and concoctions and arak and other things. Then we have a state-of-art operation theater here, wherein we have the census, which has been very much precedented. Almost every type of surgeries we have conducted under the supervision of surgeon. And we have a maternity unit, wherein we go for obstetrics and gynecological treatment of women. Almost it is through Unani medicine. NAM hospital OPD, there is some special concessions. We do not collect any registration fee from SC, ST, BPL patients and senior citizens. OPD patients receive medicine for 7 days free of cost. 50% rebate on all irrigation to BPL patients and senior citizens. We have, yes, sir, almost 17 OPDs we are running. 8 we are regularly running, and others we have special days for it. Then we have IPDs. We have 180 bedded hospital, separate wards for male and female patients. And then we extend the service 24/7. All IPD patients receive diet, drug, and investigation free of cost in IPDs. OPD census, it is increasing on, and in 2024 till date, we have got 148,000 patients treated in our OPDs. Then we have some private wards, and considering the demand from well-off patients, upgrade the accommodation facility by establishing 5 semi-special rooms as private wards, apart from health huts. Health huts comprise a patient room, visitor cum attendant rooms with furniture, attached storeroom, kitchen and bathroom for well-off patients. And we intend to go for medical tourism also. We have a cosmetology unit, almost basic facilities we are providing. And one of the important things, which is neurology and rehabilitation unit we have. And because of this, most of the patients, disabled who are coming here and getting the treatment and very much satisfied. At the rating out of 8, it is 7 rate. They rated 7 and 7.5. Variety of neurology patient at a neurology OPD, most of them are post-stroke patients. The response to the treatment is remarkable. We have diagnostic facilities, almost all basic facilities, which can be at any good hospital. We are equipped with it, with very good staff there. Then we have a regional therapy unit. What I said, we have 13 procedures as a therapy, not as detoxification, as a therapy we are doing it. Then we have one special thing, what we call Turkish bath. The representative picture of this Turkish bath, which is situated at Bhopal, but we have innovated it through electric gadgets for heat and moist damp temperatures. This hammam is known for its medical benefits in lifestyle, neurological, musculoskeletal disorders, and skin diseases. In pharmacy, we have a well-equipped pharmacy to cope with increasing demand of various formulations, and also to establish pharmacy as GMP certified. The pharmacy building has also been extended. Physiotherapy is associated with regional therapy, and we are getting very good results or outcomes by combining physiotherapy with regional therapy. Our future plans, I should not deal with it this time. The other activities, we go for workshops, CMEs, training programs. The institute actively participates in Arogya Mela, Samaj Bharat Mission, Savastha Rakshan programs, training in regional procedures, syllabus framing for graduate and undergraduate courses. Pharmacovigilance program is also here. We are the intermediary center, and till date, total ADRs reported are 430. Total MLA reports are 8,679. Awareness programs are conducted. 273 programs have been conducted through our intermediate program. Total benefits of awareness program were 10,000. Thank you, sir, very much. I hope it will go well with all of us, and we will benefit from this sensitization program. Thank you.
Sir. Thank you for the wonderful presentation, sir. Next, please join me in extending a warm invitation to Professor Bijon Kumar Mishra, sir, Chairman, Core Group of Experts for Insurance, Ministry of Ayush, for setting the agenda and objectives for the program. Sir, may I kindly request you to also introduce some of the dignitaries who are off dais during your speech, sir. Professor Bijon Kumar Mishra, sir, is an eminent international consumer policy expert who has made many years of professional experience. Over to you, sir.
Thank you. Thank you. Thank you very much. Thanks a lot. Namaskar. Good morning. I couldn't hear. Lovely. Now I feel better. Now I feel better. Now I feel better. इसको बंद कर दो. इसको बंद कर. Yeah. Yeah. So I have been also given the task of introducing our eminent people all over who are sitting in this room. So first I will start with the insurance companies. All my friends from the insurance companies, please come in the front. I want to show you all and give a big round of applause to them. Please come in the front. Please come. All my friends from the insurance companies, please come in the front. Please come in the front. Just get up and come. Come. There are a lot of chairs vacant here. Come in the front. Right. Come right in the front. Yeah. Very good. No, I'll manage. You know, sometimes government should let others also manage. So it's a very good, so what I wanted to tell you is that many insurance companies are also with us, while also many hospital owners was with us. So all the people who are into service delivery of Unani or Ayush, please stand up on your seat wherever you're sitting. Please stand up and let's give them a round of applause. Big round of applause. Big round of applause. Yeah, that very good. Please come in the front. Please come in the front. Please come in the front. Or two of you, please come in the front. Please come in the front. Yeah. आगे आइए प्लीज आगे आइए सामने आइए आप लोग बहुत इंपॉर्टेंट है हम लोगों के लिए अब प्लीज सामने आइए हाँ वेरी नाइस okay now I will tell all the students of the renowned National Institute of Unani Medicines who are sitting in this auditorium, please come in the front. All of you. And let's give them a big hand. Please come. Please come in the front. All of you stand up and come in the front. Come. All the students come in the front. Please. We want to recognize you. We want to recognize you. Please come in the front. There are a lot of empty chairs here. Please come in the front and give them a good round of applause because we have students with us. Come on. We have students with us. Please come. Yeah, we want to see you. We want to see you. Come, come. All the students, please come in the front. आप भाग नहीं सकते हो आप फंस गए इस कमरे के अंदर आप आ जाओ आप लोग प्लीज आ जाओ प्लीज सामने आ जाओ बिकॉज आपका पार्टिसिपेशन इज वेरी इंपॉर्टेंट आप लोग कहाँ से हैं आप लोग भी स्टूडेंट्स हैं ना आइए आइए प्लीज सामने आइए प्लीज सामने आइए प्लीज कम इन द फ्रंट मैडम प्लीज कम इन द फ्रंट आई वांट टू सी योर फेस यस प्लीज कम जल्दी 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 कम रनिंग प्लीज स्टूडेंट्स हेलो कम इन द फ्रंट या आप जो लास्ट में बैठे हैं आप प्लीज सामने आइए भाई हम आपको देखना चाहते हैं आइए अच्छा ओके hey 3 of you why are you people sitting there alone come in the front please come in the front okay students now I would like to invite all the faculty members of the National Institute of Unani Medicine. Please stand up. If you're sitting in the front, you please come in the front. If you are in the front, please stand up. We want to give you a round of applause. All the faculty members. Thanks a lot. Thanks a lot. Wonderful. Wonderful. It's really nice to have all of you here. I'm very proud that all of you took time to come. Please come in the front. आप लोग faculty members, please आइए सामने आइए please. Because we need you in our participation. We need you. Yeah, we need you. Yeah. Very good. Very good. Yeah, please सामने आइए. Wonderful. इधर आइए सामने आइए आप लोग भी सामने आइए आप दो जो आइए आप लोग कौन है पीछे से जो बैठे पीछे कहां से स्टूडेंट्स okay come in the front please come in the front please okay friends now a big round of applause for the organizers and also a big round of applause for a very eminent, some of my friends who are here. I want to introduce you to them personally. One is my very close friend, Soma Shekharji. Please stand up. Let's give him a big round of applause. So Soma Shekharji has been dedicated his life working in the interest of patients for more than now 40 years. We are colleagues. Okay, he's based out of Bangalore, but he works not only in India, but globally. And what I'm trying to tell you is he's representing all of us. So let's give him a big round of applause. Thank you. Soma Shekharji, you took time to come. Any other patients group in this auditorium? If you are, then please stand up. Of course, we are all representing patients. Second, I want to introduce a very known person from Bangalore. He's none other, again, a friend of mine who took time to come, very busy person, but I look at him as a mentor. He is none other but Dr. Jaga Shetty. Please stand up, Jaga Shetty ji. Yeah. And so he has been the former drug regulator of the state of Karnataka and also advisor to Government of India, Ministry of Health and Family Welfare, and also a great mentor to patients groups which are led by people like us who work for the patients. So Dr. Jaga Shetty, very nice to have you here. We look forward to your participation and your active advice to us how we should move forward. Of course, we also have another very, very important person. You know, he's quietly listening to us, but I can't do without him because we chat every day for the last 15 years, sharp 7 o'clock in the morning. Either he calls me or I call him. And that is none other than my friend whom I fondly call as Praful Bhai. His name is Praful D. Seth. Please stand up, Praful D. Seth. And let's give him a big round of applause. Big round of applause. He has come all the way. He has come all the way from Baroda to Bangalore to attend this event in this university because he's very, very passionate not only about healthcare, but he's one of the global authorities in pharmaceuticals, in pharmacy especially. He was the vice president of the Indian Federation of Pharmacists, and which is an organization based out of Geneva. And he has been working internationally and also in India and worked for many renowned pharmaceutical companies. He's been on the board of those companies. So Praful Bhai, thank you very much for coming. We hope to have a lot of inputs from you all. So friends, I should not miss out, but of course you would hear them because they're all there. They're all in the panel. Our friends from the General Insurance Council, you know, Shashi Nayarji and Madam is also here. Let's give them a big round of applause. You keep sitting. You keep sitting. Bet here, please, please. And of course, we can't do without the regulator. The regulator is also here. So I must introduce Shukur Kumarji from IRDAI, Deputy General Manager. He is also here. We also have people who are today in touch with us virtually through net. When I last saw, about 80 plus people had joined. More than 150. So big round of applause to the people who have joined. A big round of applause for the people who have joined us. We have, you know, people like Dr. Mukund Kulkarni, who heads the IIBI, heads the health vertical, you know, as I mentioned. And of course, as I mentioned, Shukesh Kumarji is the DGM IRDAI who's also here. We are so happy that it's all covered. None are missing. None are missing. You know, and that is a proud moment for us. It's a proud moment for us. You see, what I want to tell you all is that I got this assignment to chair this group of experts to take insurance in the Ayush sector in the month of October last year. And I was very, very happy because Lord Almighty, you know, gave me this opportunity because I wanted to work in the Ayush sector in the country. I had done a lot of work in the allopathic sector and still doing as a patients group person. But what I felt was we were neglecting Ayush, which we started during the lockdown days in 2020, and we still have a group of people who are under a banner called Mahamana Declaration. And the background of Mahamana Declaration is that I am an alumni of BHU, and in remembrance of Bharat Ratna Pandit Madan Mohan Malviya ji, who is the founder of Banaras Hindu University, and I got the Department of Ayurveda of Banaras Hindu University engaged. And while sitting at home during COVID time, we didn't know what to do, how to spend your time. We decided to spend time on Ayush. And you will be very happy to know, by 2021, we brought out the Mahamana Declaration. And today we have more than 300 people actively involved. Arvindji is one of the co-founders of that group, I remember. And all of us, Praful Bhai, Dr. Jaga Shetty, Soma Shekhar, we were all, and even today, and of course, I'm the admin. I know whom to bring and whom not to bring, or whom to throw out of the group. I have that privilege. And I'm the sole admin. Some of us tell me also that, you're working like one of those very autocratic bureaucrat. So I sometimes feel that you can be a democrat if you bring everybody together. Then you can be on behalf of them and work for them. So you don't have to seem as an autocrat, because you always get support from everybody. So friends, my task was to set the agenda. The agenda is, we have all known about healthcare. We all know healthcare is very important for the country to progress and for the country to become a developed country, which we are aiming to become. Because we are talking about 5 trillion economy. We are talking about being a developed country by 2047. We have given targets to ourselves. Vikshit Bharat, and go ahead in terms of reaching that. In order to reach that, what we all want to do is bring the insurance companies, whether it is private or public, because as you know, government is also into the insurance business, like ESIC we have. We also have schemes like CGHS. We have a number of government schemes are there, like Ayushman Bharat. But we also have private insurance companies who sell insurance cover to the citizens who don't get covered by some scheme or the other. And people are open to go to them also. So as a consumer person, I always believe that empowering citizens to have choice is paramount, is very important. But choice based on good, credible information, which is based on science, so that the consumer is empowered to make an informed choice based on credible information. And that's why we all have gathered here today, to take that forward. The second most important thing of our agenda, and to set it up, is that we have all the stakeholders in the room whom I've introduced you. All of them are in the room. There is nobody missing. We try to bring everybody together. And the idea is, when you sit together and you churn your ideas, you come out with bright solutions. We all know the problem, but we have to find solutions. And in order to find solutions, the mantra I always adopted, in my 45 years of career in consumer protection, is sit with all the stakeholders, make everybody to allow to speak, listen to everybody, and then come to conclusions. And we will find a solution. Yes or no? Louder. Yes, we will find. We will find a solution. What is that solution we want to look for today before we go? That Unani as a stream to deliver healthcare is known to every household in the world, in the country where we live. Now, in order to make that happen, it cannot be left to only the National Institute of Unani Medicines. It cannot be left alone to Ministry of Ayush, where our advisor is sitting there and listening to us. He's a very important person for us, because he is the Hanuman who will go and tell everybody in Delhi what to do and how we should do it, because we are going to tell him how to do also, because he sometimes feels he knows everything. But we have to tell him, no, you don't know everything. We have to tell you a lot of other things. So today we have gathered to do that. And I also want to see that not a single person, at least in our country, that I'm trying to set the agenda for you all. Not a rocket science. इतना गंभीर से मत देखिए, थोड़ा मुस्कुराहट रखिए चेहरे पे, तो आपको और अच्छी तरह समझ में आएगा. तो थोड़ा रिलैक्स फील कीजिए. थोड़ा टेंस ले जाते हैं हम लोग कभी-कभी. That is why I'm wanting you all to sit in the front, because पीछे बैठने से हम जब देखते हैं, जो हम भी करते थे बचपन में, यंग डेज में, आपके उम्र में, कि जहाँ पीछे बैठ जाओ तो आपस में यार आज चलना चाहिए ना वहां उस जगह पे, तो कौन क्या वक्ता बोल रहा है वो सुनाई नहीं पड़ता है. सो सामने ला जाने से पता लग जाता है, बात आपस में बात नहीं चलता है. तो यही ट्रिक था आप लोगों को सामने ले आने का. द मोस्ट इंपॉर्टेंट थिंग इज, एंड आई वुड क्लोज हियर, not a single citizen in this country should create a debt. वो कहीं से उधार ले या अपना संपत्ति बेचे और sell their assets to access healthcare. A round of applause, please, because that's the agenda. That's the agenda. The agenda is, while you are being paid either out of the taxpayers' money or out of the patient's money, your main objective is nobody should be falling through the crack, or nobody should be there on this earth who has to sell his asset or create a loan or a debt to access healthcare. Am I right or wrong? Because if you want to become a developed country, and what we have learned from developed countries is that if you want to eradicate poverty, which we have eradicated to quite some extent from 2014 till today, but still we have a long journey to go, is to make healthcare universal, accessible, and affordable. And in order to do that, it's not a rocket science again. The health regulator or the insurance regulator who's sitting right in front of us, he's now the only person who's sitting in the front. So you all can fire him. What I want to tell you is, they have done some enormous work in the last 1 year. Enormous work, which he will tell you. And all the work which they have done till now is in the interest of the insurance policyholders. Of course, the industry is not left out. Where are my industry friends? Yeah, there. I always look at for you, because you all are the key people, the movers, the industry. My all hospital friends who run hospitals, they're key movers. They have invested their hard-earned money or shareholders' money, or people who have had confidence in them, and they've invested that money to get a suitable return, but at the same time, they are not into profit making in a profiteering manner. They are not doing charity. They're not doing philanthropy. They want a small return in their investment. And in order to do that, again, I'll tell you a tagline which I have developed for insurance. Sankhya badhao, policy का प्रीमियम घटाओ. संख्या बढ़ाओ, premium घटाओ. You see, that's my tagline. Because every consumer comes and says, oh, the premium is very high. I said that if it is high and if you want it less, go and tell 10 other people who have not taken insurance to buy insurance. Am I right? And in order to do that, you have to convince them that their money is not only safe, but their money will be used when they need it the most to get healthcare made accessible, which of course my friends from IRDA and the industry sector will talk about it in terms of how to do that. So friends, finally I would like to say that हम लोग आज वापस जाएंगे कुछ recommendations बनाकर in terms of how do we reach that goal which I've shared with you all. And finally, I would like to say I was part of that whole movement, which also my friends Soma Shekhar was, in 2005, 2006, when we started one of the most successful public campaign in the interest of the citizens in the country, which is what all of you know about, is called Jago Grahak Jago. So friends, let's all get together to make Ayush an household name in the coming years and make it so popular that nobody goes anywhere else, but also has a choice to come to Ayush, which has not been, promoted till now in the manner done, but in a systematic manner, which we will decide today. So thank you very much for giving me this time. I hope I have set the agenda. Thank you very much. Thanks a lot. Next, please.
Thank you, sir, for setting the agenda.
Thanks. Thanks.
Thank you for setting the agenda, sir. The agenda set by you signifies your commitment to the advancement of healthcare in Ayush sector. Thank you, sir. Please join me in extending a warm invitation to Dr. Kasturbha Upadhyay, sir, Advisor, Ministry of Ayush, to enlighten us on Ayush in insurance sector. Sir, we look forward to learning from you.
Respected dignitaries, on the dais only Bejan ji is there, and off the dais, and my dear friends. Actually, insurance sector, Ayush is in insurance sector since 2008, but our presence is minimal even as on today, even after all the efforts. Just I will give. Okay. So this is the background. In February 16, 2013, first time health insurance regulation Ayush coverage has been notified under class 5.1. As a follow-up of notification, certain insurance companies like National Insurance, Star Health, General Insurance Company, ICICI Lombard, etc. have started giving coverage to Ayush treatments. Next, in 2016 was a major landmark where guidelines for coverage of Ayush systems in the insurance has been issued from the ministry, and industry started giving more coverage to Ayush. In that 2017 IRDA circular, norms for Ayush coverage, it has been notified. All the teaching hospitals and hospitals having registration with government authorities with 15 patient bed, minimum 5 qualified registered doctors and qualified paramedical staff. But these 15 doctors, because Ayush setup is still have not grown so much as compared to our allopathy. So this 15 doctors criteria was not fulfilling the need of Ayush sector, because Ayush sectors are having small setups. So that was been the agenda before the government, and all the stakeholders were pleading the government to have some modification in that. So modification has been introduced in 2019, where definition of Ayush hospital has been changed to having at least 5 patient bed, having qualified medical Ayush practitioners, and having dedicated Ayush therapy sections, maintaining daily records. And one of the main drawback for Ayush systems is we are poor in maintaining our data. And insurance coverage cannot be extended unless you maintain proper data. That's why I have intentionally kept that data maintenance for insurance claims as one of the agenda item in the afternoon session. Next, in the same guidelines, Ayush daycare centers also have been defined. Even though it has been defined and it is there in the guidelines, as on today, most of the insurance companies are not covering this daycare centers. That we have to discuss today, and we should enforce it in the ground. Next criteria for daycare center is their pre-entry level certificate from NABH or higher certification or state level certification. Current status, we have formed a core committee where we have 3 items to advise and monitor insurance sector. Professor Bejan Mishra ji is the chairman of that committee. After he come to us in the group, we have introduced a lot of dynamism in this sector, and we have conducted so many sensitization programs, 3-4 meetings, and we are coming out with white paper, and that core committee is having the meeting today in the afternoon also. Then to conduct sensitization program, it is 3rd program, then conduct study on current status of Ayush system and present a white paper. This is also will be going to be finished in another 2-3 months maximum. So this is the October is the starting. Now we are in June. By this duration, we have conducted 3, and all over the country, this type of sensitization program is going to happen. Then after that, for revision of treatment rates, guideline rates for treatment, Ayush treatment, one committee is formed. I am the chairing that committee, and Mukul Patelji is here. He is also a member of that committee. Next, for adoption of ABA ID and data collection. Mukul Patelji, he was there, no? Then one of the latest development, every person sitting here should be aware of, is IRDA on January 31st has come out with the guidelines where differential treatment for allopathy vis-a-vis to Ayush system should not be done. Any Ayush claims should be equally treated on par with our other systems, modern system of medicine, whatever it is. So this is there, and all the policies, existing policies, has to be revisited by the insurance companies. Old policies as well as new policies, and they have to decide what is the empanelment criteria and what are the guidelines, rates, and all those things. They have to negotiate with the Ayush hospital sector, and they have to finalize with that. That is the guideline of the IRDA. Then Ministry of Ayush, along with National Health Authority, we are working together to introduce Ayush under the this PMJAY, Prime Minister Jan Arogya Yojana, Atal Bihari Prime Minister Jan Arogya Yojana. Then for all executing all these things, basic problem is standard treatment guidelines. Insurance companies require standard treatment guidelines to evaluate whether hospitals are really genuinely giving treatment to the patient or they are just billing for the patient. Unless they ensure that, they can't go ahead with the processing of the claim. For that, they require standard treatment guidelines, and Ministry of Ayush is preparing already with the discussion with the GIC and other sectors, and also with the NHA. We are finalizing standard treatment guidelines for all the sectors, not only Ayurveda, yoga, naturopathy, Unani, Siddha, every system. So already draft guidelines have been shared with the GIC, and 2-3 meetings are scheduled under the chairmanship of Deputy DGHS, Dr. Raghu. So that is going on. So this is, I think, IRDA, when they present, they will cover it. This is the data from IRDA. So total out of 316 products, 259 covers the Ayush. That is the before 31st January 24 on this. Current, there may be change in the coverage. 68.7% of the products covers Ayush without sublimit. 81 products with sublimit. Now that sublimit also has to be removed. What is sublimit? Suppose patient is having a treatment and bill is around 1 lakh. Insurance company says your coverage is only for Ayush, only 10,000. You can give only 10,000. Remaining you have to bear from your pocket. That is what sublimit is. Now that sublimit has to be removed. That is the direction from the IRDA. These are all the hospitalization claims reported. See, from 2,859 in 1819, now it has reached to 10,826. Still, it is very small compared to this big country. This has to reach 1 lakh before next year. That is our target. If we work together, by the end of December, this should reach 1 lakh at least. And amount hospitalization claims, it is 75.52 crores as on 23-24, 31st December. Now, NABH accreditation, around 2066 Ayush hospitals have been accredited by NABH. Then Ayush network in Karnataka, because this is the sensitization program for 3 states. I am covering only these states. So around 162 teaching hospitals are there, sector-wise, state-wise, all the specifications are there. Then under NAM, integrated Ayush hospital, there are 7 in number. CCRS, CCRUM, CCRH has got total 5 hospitals. Apart from that, one yoga naturopathy hospital is there in Karnataka from the central government. Then, as per the resources received from GIC, these are all the companies that are providing insurance coverage in these 3 states. And this data may not be comprehensive because till our committee formed, there was no separate capturing of data related to Ayush from the all insurance companies. So whatever data they can able to collect and submit it to GIC, that has been shared with Ayush Ministry. And out of that, this is what deducted. And see, only 1 company for whole state and 2 companies for whole state in Telangana. In Karnataka, we have good numbers, but this scenario has to be changed. That is the responsibility of all of us, both hospitals and insurance companies. I hope we will fulfill this responsibility, and all the insurance companies, because IRDA guidelines says there should not be discriminatory treatment for Ayush. So everybody has to give coverage to Ayush sector. Then insurance company wise, 15 companies in Karnataka from SBI. As per the list, hospital list is there. I have to move fast because there is no time. Raheja, QBI, there are 17 Ayush hospitals recognized. Then Niva Bupa 7, Kotak Mahindra 3, Oriental 3, and other companies Reliance 3, Universal Sampot 2, and Bajaj Alliance 1, National Insurance 2, and these are 2 hospitals for the whole company, whole insurance company. Why I have focused all these things? I have collated data of these 3 states to show that where we stand. Out of so many insurance companies, 1 company for whole state and 1 insurance company having 1 or 2 hospitals recognized for Ayush sector. That is actually we are at the bottom. We have to reach far away. So we have to see that. And today you can we have a panel discussion what we have to do from the hospital side and what we have to do from the insurance company side. That we will discuss together. And this scenario has to change at least by next year. I hope next year these figures has to be changed. This is the scenario of these 2 states. See, in Telangana, only SBI covers only 2 hospitals. Kotak Mahindra is 1 hospital. Andhra Pradesh, only SBI is covering only 1 Ayush hospital. So this is the status of the insurance sector in Ayush in these 3 states. And this state has to be changed. And I think Commissioner Ayush has joined us. We extend our warm welcome on behalf of the group. Thank you. Afterwards, we conduct all afterwards.
Thank you, sir. Thank you for enlightening us. Now, we would like to extend a warm welcome to Sri Srinivaslu, sir, IFS Commissioner, Department of Ayush, Karnataka. Sir, may I kindly request you to come on stage? Now, I kindly request Professor Abdul Nasir Ansari, sir, Director in Charge, National Institute of Unani Medicine, to kindly come over and present a small token of love, a memento to Commissioner, sir. Thank you, sir. Please be seated. Next, I kindly invite P. Shashidharan Nair, sir, Head Technical Health General Insurance Council of India. Sir will take us through the topic prerequisites for empanelment of Ayush hospitals under the insurance. Over to you, sir.
Have to go there. A warm good morning to all of you, all eminent personalities, dignitaries on the dais, from the hospital fraternity, from the Ministry of Ayush, from the committee, my own colleagues from the industry, and the wonderful students of this institute. Mine is a short presentation. Okay, like this. Okay. So I'll make it short mainly because we have a questionnaire session after this. So before I begin, let me just clarify some of the thoughts shared by Mr. Upadhyay. Sir, there was never a differential treatment for Ayush under the policies. The difference was only in the limits. And the limits were there available without limit, policies without limits, policies with limits. The option was left to the customers, what they want to take. With limit, the cost is less. Without limit, the cost is more. So that is what is clarified by IRDA in their circular. And thanks to IRDA, Ayush has become more popular now. It is seen from the spike we have in claims, the spike in claim amount. So that is one area I want to clarify. It's already there, the policies. And coming to daycare and all, we'll cover later. Standard treatment guidelines are welcome. Okay, this is the only thing which I want. And sublimits was the reason why there was a price in less price in the policies. Now going to the empanelment process. Again, it's a simple one list. Nothing, there is not big difference we have in place for Ayush hospitals as such. My colleagues will later on clarify for Ayush hospitals. Some criteria may be required for Ayush hospital, mainly because of the type of treatment given, the differentiation in inpatient, differentiation in probably OPD. So this is the definition which was in place. This has been improved upon by reduction, as you covered, Dr. Upadhyay covered in the presentation. It has come down to 5 beds. So this is the Ayush hospital definition, which is in the policy. It's fairly simple, it has been practiced for some time now. So the normal requirement of an hospital, specifically for Ayush, is what is requirement for hospital, Ayush hospital, which is to be empaneled by the companies. So these are the key criteria which is required. And now the best part is that every company's board is authorized to have their own criteria for empaneling hospitals. It is not a hardcore criteria which is common for all. So the companies will decide what kind of hospital, what are the criteria, what are the yardsticks they want to put in place to empanel these hospitals. That is a big change which has happened. So now this is the improvement which has come. 5 inpatient beds are sufficient. Other things obviously is requirement for a empanelment, qualified Ayush medical practitioner, dedicated Ayush therapy sections, and most importantly, maintaining daily records of the patients, making them accessible to insurance authorized person. This is mainly to check that an inpatient is an inpatient. It's not that a OPD becomes a daycare or a daycare becomes an IPD, which we would like to control and which we will be controlling so that the costing predictable. We don't have high spike in claims, because ultimately any increase in claims overall will increase the premium, will increase, make it unaffordable for the customers. This is what I was said. Each insurance company has its own network of hospitals. Only when we empanel an hospital, every insurance company will go for an agreement with the hospitals after collecting basic data like the type of hospital, facilities they have, number of beds they have, what all doctors they have. And this agreement will be for a period of maybe 2 years. We also have agreements with hospitals, which has no timeline. The timeline is mainly on the packages which has been agreed with the hospital, which may be for 1 year, 2 year, or 3 years. The agreement includes predetermined package rates for specified procedures. I think probably Ayurveda is some one stream, but this is to be fully developed. So that is not at present. I think my hospital industry colleagues can confirm. Subha, do we have procedure cost for Ayurveda? Not full, na? Okay. Okay. That is one to be developed, which in due course we plan to develop so that there is a predictive pricing and predictive outgo. Documentation, cashless process, settlement process are detailed, and we are, as an industry, we have been promoting cashless. We want cashless even on non-network hospitals, which we are arranging through a single MOU, which can be agreed upon if the patient calls the insurance company 48 hours in advance. So cashless everywhere is catching up, but it's an MOU between the insurance company and the provider. So it takes some time for the trust to build up, to be frank with you. So that is still improving. I think it's reached around 9 or 10,000 pan India, but we are working on it. We are trying to create a health claims exchange, which NHA has developed, which will help in onboarding more hospitals through digitalization. And our main aim is to ensure empanelment facilitates quicker response time to the patient and faster settlement of claims. The idea of having more network of hospitals, it is also a directive from the regulator saying that we should have almost all hospitals in our panel, irrespective of what line of treatment is given, within the parameters of the policy. And companies, just to reiterate, companies are free to design their own board approved policies. It's up to them how they want their panel to be done. 5 beds is a minimum requirement as of date. And as far as daycare procedure is concerned, just to the benefit of all of us, if you see the daycare definition, which will come later, has today, I'll cover that. Before that is one important exclusion, which we would like to convey, which we like to carry and which we like to implement is no hospital which has spa facility or any other, recreation facility associated, we will not empanel them. It will be very difficult to have differentiation. It will be very difficult to have us to say what is gone for treatment, what is gone for the recreation. So this is a stand which we are taking, probably will continue unless there is a marked change or improvement by which the industry can say, okay, the treatment given is only for an exclusive purpose. This is one area we want while empanelment for the hospitals to inform us whether they have standalone Ayurvedic hospital, and most of the times we feel that there is integrated treatment with allopathy and any stream of Ayush. So if they have that facility, what criteria they have, how do they plan to give this integrated treatment? So that, see, if all these things are clear to us, it will be easy for us to put it in place in the standard treatment protocol. There will be no problem in time of claim, no questions asked. It will be easy to settle a claim, extend cash flow, the grievance will be less. The whole idea is that to ask this information. And lastly, there is a notice issued by NABH that they will be initiating drafting first edition of integrated accreditation. I don't know whether it has come or it is on the way. So probably we have not received it so far. Not yet, no? Not yet. Okay. It's not come. Okay. This is what we require for inpatient care. See, most of the policies in India are indemnifying expenses for hospitalized as inpatient. Another challenge for Ayurveda. And it will entail admission exceeding 24 hours. A key requirement. And it has to be medically necessary and reasonable, and customary charges are indemnified. All this is to have a control on the claims outgo, because our pricing of policy based on the predictive outgo. So we should be knowing, okay, as per past record, this is the what we can predict. Unfortunately, as Dr. Upadhyay was saying, the data is sketchy. We absolutely have very negligible data on Ayush treatment because that itself was so low. So no company has bothered to, code it and collect this data on Ayurvedic treatment. So unfortunately, we don't. In fact, Professor Mishra was asking us to give us the data. So whatever available we are given. So that has given a misnomer. It is not that one state, there is only one insurance company. All insurance companies are covering Ayush in all the states. Hospital empanel may be few, but pan India, any policyholder is entitled to Ayush treatment. So irrespective of state, the problem is empanelment of hospital. How many hospitals are exclusively providing this, or how many hospitals have an Ayurvedic wing, which can be recognized. Probably that is why you see the number being less, but this will increase. This will increase. And documentation is required. This is again in line with other hospitals also. And most important, the need for hospitalization is to be demonstrated. This is a very key criteria in Ayurveda. We don't want OPD becoming inpatient or IPD. So this is the last important thing is that it will decide or help us in determining the cost. We have to ensure that nobody takes an IPD treatment under the guise of being an OPD. Sorry, I'm saying this, but all this we are predicting or saying is that when we empanel an hospital, if these things are in place, it will be easy for us at the time of claim, providing cashless. There will be no grievance. There will be no questions asked if everything is clear. So treatment protocol will have to bring in something on this. Not easy, but it can be worked around. We have experts like you and all from the Ayush Ministry, Professor Mishra, so many people from the industry, our own colleagues. Together, we'll be able to bring that in place. I think that's all from my side. The questions on this can be answered when we are an open session. Anything on hospitalization, we have colleagues from the industry who day in and out are treating with claims. So they'll be able to answer all those questions later. Right now, this is all from my side. Thank you. Thank you for me.
Thanks for taking us through this important topic on empanelment of hospitals, sir. It was a wonderful presentation. Please join me in extending a warm invitation to Mukund Kulkarni, sir, Head of Health, IIBI. Sir will take us through the Rohini platform, which stands for Registry of Hospitals in the Network of Insurance and aims to create symbiotic relationship between the stakeholders. This is going to be an online session.
Hello, good afternoon, everybody. This is Dr. Mukund. Can you please confirm if I am audible and visible as well?
You're audible, sir? Yes, sir, you're visible.
Thank you so much. Can I start?
Yes, sir, please start, sir.
Okay. So good afternoon, everybody. My name is Dr. Mukund. Thanks for the introductions. I head the health vertical at IIB. Before I jump into the specific agenda of what is Rohini and how does it help the hospitals, I would like to spend some initial time on also speaking about what is IIB and how is it participating in the health insurance ecosystem. So can you please confirm if my slides are seen on the screen, please?
Yes, sir, your slides are visible.
Thank you so much.
Please continue.
So IIB is basically Insurance Information Bureau of India, which was established more than a decade back. And the idea was to create a vast repository of data related to the health insurance operations in India. So we do have immense data available, and we are at this moment proceeding on collecting those data in a real-time fashion. The vision is to become the analytical hub of the health insurance industry in India, practically meaning any kind of insights, any kind of data, any kind of report that deals with the health insurance performance in the country should come out from IIB. That is the vision. So we're working hard on that. There are a lot of data as a product and data-driven products which are used by various insurance companies today to improve their risk management, pricing, as well as operations. There's a long roadmap for IIB towards creating much more value. And one of the roadmaps definitely very quickly we will be getting into is focusing a lot on how the hospital ecosystem is participating in the insurance. What has been the key experience of various hospitals deriving through the insurance claims data. And within that, I would also say that we are going to focus even more specifically on Ayush, which is the subject of interest for this forum. And how that will happen is something which we will speak about a little later when we speak about the hospital empanelment. So that's about IIB. One of the products which we have is Rohini, and Rohini means the registry of hospitals in the network of insurance. And it was established again because there was no central repository of hospitals available for the health insurers. So even today, many of the insurers do spend a lot of effort in empaneling various hospitals for their products and services. Here, the idea was to create a centralized repository, more so in a form that it can be uniform across for all players. At this stage, this repository is created directly from the hospitals, which means the hospitals have a portal accessible where they can register themselves under this repository. I will show the process of how this is done in the next slide. But why this registry and repository is important is because it gives a clear identity and validation to all the hospitals who are interested in taking part in insurance ecosystem. And I think, as commented by the earlier speakers, this network is growing exponentially and organically. So, which is a very happy thing to look at how the hospitals are also interested in participating in the insurance ecosystem. Now, how does it work? So, these are the 5 steps in which any hospital can get registered under Rohini. So, first, they have to put up an application in the Rohini link. And one step of verification that happens is either they are already empaneled with any of the insurance companies of India or any of their outsourced TPAs. If that process is already done, they submit the name of that specific insurer or the TPA, then automatically it moves to the third process, which is where the second level check at IIB on certain documentations is done. And if satisfactory, then there is a specific Rohini ID, also called as global location number, is allocated to the specific hospital with a subscription, and that subscription is valid for 3 years currently. Now, in case the hospital is very new, for the very first time, they do not have any empanelment with either the TPA or the insurance company, then they can access Rohini helpline, who will guide the specific process of getting first empaneled with any of the TPAs and insurance companies before it can start registration process further. And of course, after a period of the subscription, which is 3 years, the renewal happens. In case there's no break or there is no adverse experience reported on the hospital, it's almost an automatic renewal that happens. So this is a process in which any hospital, and this applies to Ayush hospitals as well. I'm very happy to see there are a lot of Ayush hospitals already registered in the insurance ecosystem. In fact, there are 6,000 plus hospitals where already claims have been paid. And I think Dr. Kostuba was presenting on hospitals present across geographies tagged to various insurance companies. And we also have claims paid from the insurance companies on those hospitals. So that's a benefit to the insurers, that they get access to one-click access to the pan-India network of validated hospitals. And they can also look at geographies where hospitals are present, and these geographies may be an area of interest for them to expand. And more or less, we are also kind of creating a standardized repository here, along with the contracting and utilization trends. I'll speak about some of the enhancements which we plan to do at Rohini. I call it as Rohini Plus, which would make the repository much more richer in terms of the details about the hospitals, as well as, because we also have the claims experience data from these hospitals, we can come up with good quality trends and analytics on these hospitals as well. Now, this can also be a very good input towards creating the standard treatment guidelines. I think the mention was made about specific committee working on that. The past experiences can also become a very good input, and IIB will be very happy to support that initiative as well. So that is all for benefits to the insurers. For hospitals, obviously, the benefit is it's an online, very quick registration process and getting included in the insurance ecosystem. It gets validated, and we are not looking at hospitals to approach multiple insurance companies or TPAs to validate themselves. only one TPA or insurance validation is enough for them to become eligible to be participating in Rohini. And once they do that, obviously they also, once we also provide them little more access towards the trends, they also would look at opportunity of contracting with various insurers where they're trying in a fragmented manner. So that can also come up as a futuristic value to the hospitals. We have launched this almost 10 years back, and in last 10 years, as on date, there are more than 40,000 hospitals already registered. And as I said, out of this 40,000, more than 6,000 hospitals are specifically for Ayush treatments and Ayush care kind of thing. This is the homepage of the Rohini link. Of course, we will share this separately as well for the participants or hospitals here who want to take up this registration immediately. This is a link for which they can go ahead, and the process, as I mentioned earlier, 5-step process to get registered. Future roadmap, as I said, at this stage, it is a validated repository giving an identity, but we would enhance that entire Rohini ecosystem in those 5 areas which you see on the slide. The first one, obviously, is we'll create separate flag for Ayush so that we can track Ayush trends of hospital empanelments as well as hospital experience and utilization in the entire ecosystem. Second, we will look at what all insurance company have data which doesn't get submitted to IIB, or they have it in addition to what they submit. We will look at reconciling all of that. I call it as Rohini Plus, which can become much more richer, updated, and uniform information for everybody to access. If we club this with the claims data which we get, we can come up with a lot of utilization and cost of healthcare service analysis, which is what we are planning to do once we have much more data on this and empanelments happening. We're also looking at integrating. I think there was a good mention about the accreditation data and accreditation information carried by NABH today, as well as the databases carried by PMJY scheme about the same hospitals. We will start looking at talking to them and call it as Rohini Plus Plus, wherein we also include those external databases within this. That's what the future roadmap is. And of course, with all this rich data, we can do a lot of hospital analytics specifically related to more important ones for the health insurers as well as for hospitals, is looking at the experience, cost, utilization, and trends. I think this was presented earlier from the GI Council source of data, but this is also coming from our IIB source of data. As I said, more than 6,000 hospitals have already participated. There are claims which were assessed through these hospitals. We can share this in details if anybody is interested. So that's about Rohini specifically, and how hospitals can leverage Rohini to participate in the insurance ecosystem. Very happy to take questions now, or if it is scheduled to be later, we can take it offline as well. Thank you so much.
Thank you, sir. Thanks for joining us today, sir.
My pleasure.
Thank you, sir. Yes, sir. Questions will be asked later in the discussion.
Okay, no problem. Thank you.
Okay.
Thanks.
Thank you, sir. Thanks for joining us. I kindly invite Sri Sukesh Kumar, sir, Deputy General Manager, Insurance Regulatory and Development Authority of India. Sir will enlighten us about the compliant redressal mechanism for insurance sector. That's it. The mic is. This child.
Okay. Good afternoon.
Good afternoon to all of you. Yeah, I am Sukesh Kumar, working as DGP in IRDA. I would like to extend my thanks to National Institute of Unani Medicine for inviting authority here, IRDAI, to discuss about grievance redressal mechanism. Actually, one of the objective of Insurance Regulatory of Development Authority of India is to spread awareness about insurance as well as maintain confidence in the insurance sector. And for that, there must be an adequate grievance redressal management. So we shall discuss here only the related to the protection of policyholder and what are the regulatory provisions related to the grievance. So recently we have come out with the revised regulation in respect of protection of policyholder interest, and which specify and define exactly who are the complainants and what the complaints are. So what type of complaint can be? It can be written form. It must be in written form, but all type of written form like letter, courier, mails. Even a person comes with the through call center, then insurer must make adequate provision to make it in writing by voice recording or any another techniques. It can be against any insurer or to any distribution channel. Complainant means a policy holder or prospect who intends to buy an insurance product, or nominee or assignee or any beneficiary of the insurance policy. And the same again, he must have a complaint against insurer or any distribution channel. Next, we shall how to go next. Pardon me. Yeah. So this regulatory provisions clearly tells about that how an insurer will deal with the complaint. Every insurer will have a system, including IT system and procedure for doing everything related to grievance or complaints of the customer. It should be registering the complaint and giving timely solution to the complaint. It must also include that if a complainant is not satisfied with the solution provided by insurer, then how he should proceed. Like he must be given the address of ombudsman where he can escalate the matter in his final resolution provided by insurer. Further, it also includes not only insurer but each and every distribution channels. Further, no insurer or distribution channel shall discourage any policyholder or claimant that you won't make any claims against us. So the grievance redressal procedure exactly will tell, and it has been already been specified, and that to be followed by each and every insurer or distribution channel. Actually, the procedure which has been provided to be followed by insurer, once you receive the complaint, you must immediately respond and acknowledge the complaint. If you have certain additional information which you need to properly address the complaint, then you must do well within in a week. And if insurer must provide a resolution within 2 weeks, not more than 2 weeks, within 2 weeks, And in final resolution, he must also mention that if you are not satisfied with the resolution provided by us, I mean insurer or distribution channel, then where you can escalate, like the contact details, name, everything of the insurance ombudsman. And these all things should be published, particularly on the website of insurer. Further, after this regulation, we have detailed the same thing in prescribed manner, although it is principle based and not point to point or prescriptive in nature. It mentions that some grievance and everything can be provided online. Various call centers, it can be through registered. Insurer will make arrangement of grievance portal or app, anything where insured can register his complaints. And insurer must have a board approved grievance redressal policy. And the final aim is to move towards zero grievance. This we have already discussed. And then integrating grievance portal with Bima Bharosa portal for facilitate registering tracking online. Actually, you can register your grievance with later also. The portal is available. It is earlier used to as IGMS. Now it is Bima Bharosa. So you can register its compliant. It's a two-way or three-way system, you can say. It's already connected with all insurers, complainants, and it mirrors the real-time development and communication made by insurer through the customer, through IRDA to the customer. So where you have been given a resolution, where insurer need additional information, these all are reflected here. So yeah, and the timeline have been decided. There are prescribed timeline that within 2 weeks you have to provide adequate resolution. That's all from my side. Thank you.
Thank you. Thank you, sir. Thank you, sir. Next, we will have a panel discussion. So this will be basically a question and answer segment. So all the participants and dignitaries, officials can ask questions and there will be discussions. The panel members will be replying to will be responding. Please raise your hands. I request the panel members to come over the dais. Kindly raise your hands if you have any questions.
Sir, myself, Dr. Yunus Munshi, I am heading National Research Institute of Unani Medicine, Hyderabad, which is NABH accredited institute, and we have NABL accredited laboratories. So it is part and parcel of Central Council for Research in Unani Medicine. And I think it is the only Unani hospital in Telangana which is NABH accredited. Now, as far as Ayush is concerned, we are most concerned with the holistic approach, preventive measures. For preventive measures, we employ certain regimens for detoxification, which we call as tankiya badlan, tankiya, so that the person remains healthy for the year ahead. Can you cover that also under the insurance plan?
The mic, please.
let me be quite frank with you. For me, Unani was an education today, in the first presentation, number one. Number two, even my colleagues from the industry, I don't know whether we have any claims under Unani, Shubha, United, ICICI. No. Why I'm saying not, I'm not being negative. See, for us, insurance, we develop a policy, develop a coverage on the basis of claims. How do we pay a claim under the policy? How do we devise a policy for a particular treatment? So what you are narrated here, you said there is an inpatient treatment.
Yeah, we have inpatient department.
It's a necessity.
Yeah, it is necessity, definitely.
Yeah. And it is an effective treatment.
Surely.
From the point of it may not occur again.
Recurrence is everywhere.
No, not that way. I'm saying, see, that way anyone have a problem. Why I ask this?
Okay.
No problem. Why I'm asking this is that we look at all this when we are developing something. See, it should not be a temporary curative treatment. It should be an effective treatment so that, see, what will happen? Suppose we accept a treatment under the policy. If it's recurring, it's only increasing our liability. How do we price it? That's why I meant by effective. See, nothing is effective. I can have a, a recurring problem for like diabetes. It can be continuous. So why I'm asking is this: is an effective treatment like an alternative allopathy? It will be covered.
Definitely.
Shubha, would you like to add something? We can just, yeah, anything different from that. That's what I'm saying. We will cover it. In a nutshell, why I narrated this is that for a policy to address any treatment, it has to be effective.
So my question was whether preventive care is also covered or not.
Preventive care is not an inpatient treatment. No.
It is inpatient treatment. We can take the patient.
Please.
The Unani treatments, what are the guideline states and what are the treatment criteria? It is already mentioned in the IRDA guidelines. Only thing, claims has to come to insurance companies first. Then afterward, when you are participating in the insurance sector, then you can, when there is more and more claims, you can ask for the empanelment. So that is the purpose why we are sitting here today. So we have to explore all those things and we have to move ahead.
And number two, I have been given to understand by my authorities that 130 diseases have been formulated that STG, special treatment guidelines from the Unani side, and that has been submitted to the ministry. If you are covering even the OPDs, that simple OPD is being conducted in the dispensary and you are covering that also. Why not Unani and other Ayush sectors?
Let me again clarify. OPD as a rule is not covered by all policies. It's very limited. Why? I'll tell you. See, maybe people here can confirm. OPD is a confirmed liability. Today I have an OPD under the policy. I say 3,000 rupees OPD. Take it from me, that 3,000 will get exhausted in the year. So it will increase the pricing of the policy. And there are very few people, 90% of people are not interested in OPD because the cost goes up for the policy. So OPD gets covered in some policies, not in all. So if OPD coverage is under a policy, it will get covered.
No, my only question is, you can hear me?
Yeah.
Because I'm born with the loud voice. Yeah. No, I don't need a mic. No, it's not. Oh, sorry. But is it working? I don't know. Is working?
Yes, this one is working.
Okay, because I have to hold both because one is for the online and one is for this. Is it? Same thing. Okay. No, what I want to tell you, please be seated.
Okay.
And thank you for asking these questions. And I like your attitude to be adamant. Nahi aap karo, aap batao. I like that attitude because what happens is, louder. Yeah, that's right. That's right. What I am trying to say, the first thing is, if you are in a hospital, first get that empaneled. Insurance ho na ho, pehle to empanel to karo apne ko.
Sure.
Isko pehle karo, please, so that at least inke data mein dikhe ki one Unani hospital in Hyderabad is empaneled with the insurance companies. So make that happen first.
Okay.
That's the first thing. Okay. Second thing is, first to you find out कितने लोग आपके पास आता है जिसके पास insurance cover है. First, let's find that out. Because most of the people, as I know, and what I saw today, it was a real great exposure I got today when I visited the hospital of the, institute today, is that 450 people are coming. And why they are coming? They are coming because they have trust in this system. They believe this system and they have come. Now, when they have come, at least little decency we should have is to make sure that we are in touch with them every time. So we must have a data that how many people are coming, who are the repeat people coming, how many are new coming. We must have that data. Because when they are coming to us, they are not coming because they will get a claim. Everybody, including me, I take an insurance cover not to get a claim. But when I am in trouble, I do not find it difficult to get the money to get that treatment. And that's why we do insurance. We don't do insurance that हमको ओपीडी में भी जाना है, हमको इनपेशेंट भी जाना है, हमको जबरदस्ती जाना है, इसलिए नहीं लेता है. हम लोग इसलिए लेता है इंश्योरेंस कि यदि हम, because many a times I am having a health insurance for the last 20 years and I have claimed अब आयुर्वेद लेकर 2 बार. I went to allopathy once during COVID time and I recently went to Ayurved the second time to get a claim for myself. But the point which I'm trying to make is no policy holder takes an insurance cover to get a claim. They take an insurance cover to cover the risk. Sashiji, am I right or wrong? Okay. So what Sashiji also has to remember is if somebody is coming to you or your members of the GI Council for reimbursement or for cashless, they are coming not because they are fun-loving people to claim. They're not coming for fun. They are coming because they need that money. And because they are paying a premium every year, when they find it difficult to pay, they want the insurance. Because many a times I have gone to the hospital, I have not claimed because they were small amounts. Why should I unnecessarily get into a process? I would rather have a no claim bonus at the end of the year. So what my contention is, there are different profiles of citizens or patients, and we have to understand that profile. So I'm very happy. I'm also based in Hyderabad. Sometimes you should invite me to go to your institute.
Sure, sir. You are always invited.
No,
You are always welcome.
no. मतलब वहाँ जाके I don't want to get lost. I want that. Yes, I know where I am going. What I am trying to say is, get more and more citizens of Hyderabad visit your institute.
Sir, we have 650 footfall per day.
No. 650 कुछ नहीं है.
But it is big in a city like Hyderabad.
नहीं, हम जामनगर गए. Where is my vice chancellor friend? Here. Yes. Mukunji. 2,000 people go there every day.
I know that.
All clap louder. Yeah. Why do you are so confused in clapping? You see, when I went to All India Institute of Ayurveda in Delhi, 2,000. Yeah. I'm actually warming them to ask questions. So anyway, what the advisor is saying, lot of hands are there. Because I didn't see many hands, only one. That's why I'm trying to warm you up to raise your hand. Who's the second one? Very good.
Sir,
excellent.
Let's
go there.
Just a minute.
My God.
I have
We can have a discussion individually after.
No.
I was going through the Rohini
Speak.
empanelment.
Yes, please.
रोहिणी में आपने स्टेट रजिस्ट्रेशन रखा है, वो आवर्स इज सेंट्रल गवर्नमेंट हॉस्पिटल. तो जब हमने एनएबीएच ले लिया तो उस वक्त भी उन्होंने एग्जाम्प्ट किया था स्टेट रजिस्ट्रेशन से. स्टेट रजिस्ट्रेशन लेना थोड़ा सा टीडियस होता है. व्हाई डोंट यू कंसीडर एनएबीएच एक्रेडिटेशन? दैट इज आल्सो देयर. आई थिंक वी हैव द वन रेस्पेक्टेड.
Yes, we have IIBI.
Yes.
Come on, Major Dr. Mukund, are you there? Are you able to hear us? Mukund Kulkarni, please unmute and come. Mukund?
और दूसरी एक सजेशन थी, ये जो IRDA में है, why don't you have a coordinator from all the systems of Ayush, Ayurveda, Unani, Siddha, homeopathy. एक coordinator रहेगा जैसे BIS में है, Board of Indian Standards. We have the coordinator there, and
Bureau of Indian Standards.
Yes. We have the coordinator there, and we have posted one Unani research officer.
No. So I'll tell you. Good idea you have given. Very good idea. As it is, IRDA is short of people. After great difficulty, I got IRDA to attend today. I had to talk to his boss to see that they don't go unrepresented. what I am trying to say, if you all come together and tell GI Council to do this, depute somebody in IRDA to work
Definitely,
for you all.
you have just to give a formal letter to our DG and we will send a person there. जैसे हमने
And they are based out of Hyderabad, by the way. You know that.
We can do nothing doing.
IRD is based out of Hyderabad.
CCRM is
so
always.
anyway, so what I would say.
Good afternoon, sir. So this is Dr. Mukund. Sorry, I just got unmuted.
Yeah, please, Mukund, please go ahead. You gave an excellent presentation. Go ahead.
Thank you so much, sir. So even IIB is based out of Hyderabad next to IRDA. So if there is anything related to Rohini, any queries, any Hyderabad-based hospitals wants to approach us, please feel free. And to answer to your question, I think I mentioned in my slide, the future enhancement for Rohini is to integrate with NABH. And if that happens, definitely Rohini ID and Rohini registration process will not be an additional process. There'll be one single registration process which will happen. It is
Thank you,
not
sir.
currently there, but yes,
Thanks
in
a lot.
future we will plan. Yeah.
Very good. Very good. Yeah, my friend there. Yeah. Please introduce yourself before you ask the question.
Yeah, good afternoon, everyone. I'm Dr. Pannak Kamath, Ayurvedic doctor, in representing Ayurveda Academy, a non-profit organization, and also runs a small 8-bed hospital in Bangalore. So we are not empaneled with any of the insurance companies. And my question is it required to be a NABH accredited hospital to get empaneled, or Karnataka State Registration Board, KAUP, we have registered already? So it is enough to empanel with the insurance companies. I have a question also.
Shubha, would you like to respond to this? I think we can empanel. I don't see a problem. Can you respond? She's from ICICI, so they do this. Go ahead, go ahead.
Yeah, good afternoon, everybody. This is Shubha here from ICICI Lombard. So NABH accreditation, NABH's basic requirement is 10 beds. So for anything below 10 beds, we cannot make NABH accreditation as mandatory for insurance empanelment. Since insurance empanelment, we allow with 5 beds itself. So anybody between 5 and 9 beds, NABH accreditation will not be mandatory.
Okay. Yeah. Yeah, thank you, sir. I have another question. So regularly we get admitted some of the patients in our hospital. So out of 10 patients, 1 or 2 patients do ask about the insurance. Till we get a empanelment, so not cashless. So after once they pay the payment and all, they can get the benefit of insurance if we give all the papers regarding that.
Yeah, reimbursement.
Reimbursement is possible.
If he has a policy, he has to, preferably he should call. See, in the policy as a call center number. He has to make a call there saying that he is going for a planned treatment to some hospital, giving details about what is undergoing. So that helps. Then the insurer will be from day one associated with the hospital also. Okay. If there is no cashless, they will say, okay, fine, you go ahead. And the reimbursement will be faster because the insurer knows what is the line of treatment being given, what can be the estimated cost and all. Okay. So it helps if the intimation goes in advance. Otherwise, he has to take a reimbursement route, which is submission of all documents after treatment, which can take some time. Then the insurer has to check which hospital, what treatment it was, whether the alignment treatment was proper. So from day one, it is available for the insurer. The claim settlement will be fast.
Yeah, it is applicable for all the insurance which are available in India, or
yes, yes, everyone follows this.
Okay, thank you.
Namaste, all of you. Sarveshwar from JSSRBD Medical College, Mysore. We have a teaching hospital of 260 bedded, and we are in the 3rd cycle of NABH. My humble submission is that in Ayurveda, we get a lot of challenging patients, and patients stay in the hospital beyond 3 weeks or 1 month, like stroke, paralysis. Sir, Professor Bijan Mishra-ji, any thought process are there, any maximum limit that patient need to be admitted in the hospital, and the frequency of admission? Because in challenging patient treating, patients also require for sitting, getting admitted in the hospital. Clarification regarding the same. But the challenging patient. I'm looking for particularly stroke. Though has but neurology, this medicine better accept the curing rates. Over to you.
You open with you very difficult question to answer because what you are asking is requires more of medical information. Number one. Number two, I hope there is no mix of palliative care. There will be some, isn't it, of the patient? What you said is palliative care or it's purely treatment. Treatment. I think purely treatment. See, number of days, we also see, I told you anything, every policy has a predictive pricing. So if it's a special case where a patient has to remain in the hospital treatment for a particular period, very difficult for us to say, okay, you cannot go beyond a number of days. It can happen in allopathic treatment patient also. Why only Ayurvedic? It can happen to anyone. You see, as long as it is medically required and I think recorded and approved by a treating doctor, I don't see an issue. But still, I think I will again go back to my company colleagues to say their views, whether they have received such cases, how they are treated. Shubha or United India or anyone, or not monopolized, but Shubha, since I know her personally, I'm requesting Shubha, can you just attend? Anybody, any insurance company can, those who have handled a case like this, probably that will really help.
And if you have not handled also, it will help.
Then how do we handle? Na? That's the best way. Shubha, would you like to respond? Give your thoughts. There's no commitment. It's just we are sharing thoughts.
Yeah, doctor, to answer your question, what I would like to say is I'd like to reiterate again what Mr. Shashi has mentioned. So defining the boundary between treatment and palliative, that is palliative care, would be the difficult point. So it'll have to be dealt with on a case-to-case basis. Like even in allopathy, let's say we have somebody with an RTA who is, long-standing care in the hospital, ICU treatment, 20 days, 30 days. We deal with cases like that and they get paid out, subject to some insured being available. The same would apply even to Ayush. So what we need is that it is treatment necessary treatment, medically necessary treatment, and that does not, border into palliative care or, pure rehabilitation. That's my point.
Excellent, excellent. You have put it up very well. 1 minute, 1 minute, 1 minute. You are from JSS, you said, Mysore. So I've been involved with your university. Is our friend
Suresh
Surendra Singh?
Surendra Singh, yeah. Surendra Singh, the Vice Chancellor, yes, sir. Yes.
Is he still there? So
Yes.
I was part of your board, by the way, and I visited your hospital.
Thank you very much.
What I want to tell you,
I'm not from JS Ayurvedic Hospital.
Acha, but I visited the main hospital.
Yes, 1,800.
Surendra Singh never took me to your hospital, so I'm sorry.
No,
I'll
we
go next
invite you.
time.
We invite you, sir.
Next
Yeah.
time I'll come.
Thank you.
What I want to tell you is, see, insurance again, in my opening remark, you heard, it's not charity.
Yes, sir.
Please remember this. It's business.
I just
The point we forget as policy holders, we think that if we have bought a policy, I bought the company. No, I'm not a shareholder also. I am a beneficiary. So there is a large difference to understand that when I go to, say, JSS, vis-a-vis, I go to a hospital who asks me the first thing, are you insured? पहला पूछता है क्वेश्चन. वो ट्रीटमेंट शुरू करने के पहले पूछता है. इमरजेंसी में भी जाता है तो कोई नहीं है जब तक आप नहीं बोलोगे कि आप इंश्योर्ड, दे फाइंड यूरेका, हाँ गोल्ड माइन आ गया. You know what I'm trying to tell you is, even after Supreme Court's directive to all hospitals that you are not supposed to turn back a patient who needs immediate treatment free of cost, you have to give it. It is mandatory as per Supreme Court order. Okay, but it's not been followed in our country. Let me tell you that. But what I want to tell you that if you go with the insurance policy, please remember it is governed by a lot of do's and don'ts. There are a lot of terms and conditions. And what you have said, very beautifully you have explained. Very beautifully you have explained. You see, there are a lot of terms and conditions. But within those terms and conditions, if you, whatever is applicable to you, you can claim. And you are eligible to do that. And in order to do that, I would recommend you organize some kind of a workshop at your hospital where you bring and invite the insurance companies, you invite people from GI Council, you invite people from patients groups, and have a good deliberation to educate people so that if you don't have insurance, to get insurance, and if you have insurance, then what you should expect out of that.
Thank you.
Okay, am I clear?
Thank you, sir.
You still have a question to ask?
No, one more thing to Kaustubhaji.
Kaustubhaji.
Sir, same thing from continue from the good friend. Wellness is going to cover in our Ayurveda also wellness.
It's not to be answered by me. It should be answered by IRDA and JIC.
Thank you.
But at present, wellness is not covered. But we in the core committee, we are discussing these issues. And all those regulatory agencies are part of the core committee. And we will discuss and come with a way out.
No, not only that. The
But
good
we
news
have
is, you see, the government doesn't speak much. They want to keep within themselves. Because, you know, डरता है लोग सब. जो डर गया वो खत्म. Anyway, what I want to tell you, there are interest shown by insurance companies who have had discussions with me, who have said that we are seriously looking at how to consider, you know, to include some part of wellness or OPD or preventive care, as they say, for policyholders who have been there for a long time with them, how to encourage them to become healthier in their senior days, or, you know, post-retirement days and things like that. So they are thinking of designing, they are in the process of designing, because it's a science, let me tell you. Actuarial is a science, insurance is a science. It's not only making money. It is a science. So we are all trying to figure out how that part of Ayush can get covered, which is doing huge, enormous work in terms of preventive care. So we will try to tell you when the time is there. You keep serving the citizens.
Thank you, sir. Because Ayurveda not speak health.
Yes.
Therefore, this is
Correct. Why Ayurveda? Even Unani.
altogether Ayush. Yes. Thank you, sir. Please keep in the.
Correct. We are keeping in mind. Next, yes, there in the corner. Yes. Ajay, here. Sorry.
Good afternoon. Myself, Dr. Mrityunjay from Shatai Ayurveda Yoga Retreat. We have a NABH accredited 20-bedded hospital. My question is to Shashidharan and Raju Vasudevan. See, the number one is the empanelment process. Is it required for each and every insurance company? We have to get separate empanelment, or Rohini is enough? Number one. Number two question is, especially Raju has to answer this because all the stakeholders will be very happy. The price disparity. Whenever one insurance company comes to us with the insurance provider, when we give one particular billing, they will give 100% coverage. Some 80%, some 70%, some will reject. Okay, I don't know why that is happening. Very regularly happening, especially in our industry. Number two, one more thing what we noticed, especially the people who are sitting in the insurance companies, especially for example, ICICI is there is one Ayurveda doctor, SBI is there is one Ayurveda doctor. My notice, how we've noticed is, actually the doctor who is sitting, he don't have a knowledge of IPD first of all. He might not have run the IPD facility at all, but he fixes the pricing. He says that Katibasti is 150 rupees. Okay. One more, for example, ICS Lombard, even if we are putting it as a 850 rupees or 100 rupees, their claim is approved. But whereas some other companies, they are sending with the clarification. This can be done in OPD, this can be done in lesser price. We are unable to understand. See, it depends on even the location wise. If our facility is bigger.
Come to the point. Be brief because we're running out of time.
No, that is what I want to tell, that how to control this price disparity and how to minimalize or simplify the empanelment process for both of you. Thank you.
Yes, please. Yes, certainly. Yes.
Let me first. Let me just first address your question about empanelment with various companies. See, as of date, every company has empanelment various hospitals because there are many things which goes, mainly the pricing. They fix the packages cost with each hospital, And ultimately, it is not common for all the insurance companies, for all the hospitals, because even if we do that, it can get into some competition problem also. We cannot do that. We'll be more than happy to have a common price for a procedure at an hospital for all the companies at one hospital, at a particular center, depending on various criteria. But today, it's a challenge for us to do it because many hospitals would not like that happening. Maybe way forward, based on Supreme Court decision, there will be some changes in this. Number one. Number two, we are trying to develop a common empanelment, purely empanelment of hospitals pan India at KI Council. This will take some time. Then we'll have a standard agreement in place so that all the hospitals can have a common agreement. So all the hospitals will be empaneled by council. Of course, all practical things, checking of hospital, interaction with the hospital, everything will be done by respective companies and respective states. They will have a say on all that. Coming to your second part, why the disparity in cost in pricing? That is something will depend on case to case basis. Today, I cannot answer you why. Like you say, ICICI is paying, some other company is not paying. I don't know the other side of the story. So it's very difficult to answer that. Why that's happening? It is happening. I will not deny that. But it will be a stray case. With all cases happening, I have my doubts. If it is happening, there has to be a reason. So unless you know the reason from the other side, I cannot address that. We'll try to reduce that because we are having interaction with hospitals. Tomorrow also we have interaction with hospitals in Coimbatore, IMA, in the Medical Association. An area they will tell us. So probably we'll way forward, we'll have some grievance redressal forum from hospitals also. Not way forward, it will happen. And there will be some hospital representatives also in the committee. We're trying to work out how. But we don't want to address all grievances. We'll try to address key grievances which can happen in an hospital, like pre-authorization is given, then the amount is denied, something like that. Critical ones. Rest, we'll leave it to the companies to address because we don't have the bandwidth to address this at a national level. But 101%, where it is happening in a very big way, where you feel it is bad, probably this thing will get addressed to grievance redress in future.
Thank you.
Raju. Mr. Shashidhar Nair has answered in quite detail, but just a couple of points quickly. Number one, if you empanel with respective insurance companies, in the process of price fixation with that company, mutually negotiated and kept. So that is one way to get out, right? So then you don't have random case by case negotiation. That's number one, right? So another question has already been answered. But Professor Bijon, on the wellness part, I had one thing to add to a couple of questions which came here. Number one, that today insurance policies don't cover in general, while there is progressively a move towards covering preventive and promotive, etc. Having said that, and to the doctor from Hyderabad, aap sun rahe? So there are many TPAs, brokers, insurance companies which run wellness programs as part of their services to their policyholders, particularly corporate clients, right? So what I would encourage is, just as in Ayurveda, yoga, etc., Unani leaders should come up with proper definition of what wellness programs, what is constituted, what is the benefit, right? So to bring a little bit more awareness about what you are able to offer under Unani, and go out to some of the companies in Hyderabad, even directly to corporates, right? You don't have to go through insurance. You may find there are a lot of takers over there. So two-pronged, talk to insurance stakeholders, see if in their value-added services to their policyholders, they would like to include some of the programs. Possibly in Hyderabad, some of the markets will be very interested to look at what we offer. Secondly, go directly to corporates and try, right? Thank you. But you need to bring more awareness about what Unani can do in wellness. Thank you.
Thank you.
Abhi, two questions from the audience.
Just a minute.
Next, after the session, we will have a discussion.
Good morning, sir. I'm Dr. Rajeshwari from Government Home Medical College. From morning, I'm observing you are talking about only the. I'm from Government Homeopathic Medical College. I just wanted to know, from morning, I'm observing from only Ayurveda and Unani has been spoken. What about the status of homeopathy? Homeopathy. Empanelment of homeopathy. Yeah, I just wanted to know about homeopathy, empanelment of homeopathy. answered. I couldn't hear what they said.
I'll take that. I'll take that. See, shall I address that? Short answer. Madam, come to 1.5, 2 years back, I was party to Homeopathic Council, Delhi had developed insurance package. So they are coming out with some criteria. I think, of course, Dr. Upadhyay will know more. So we, at present, I don't know how many inpatient treatment happens in homeopathy. So because we don't want, sorry, I'm being negative again. See, we are always worried about mushrooming of hospitals. Today we say, okay, insurance policy covers this line of homeopathic treatment. There will be creation of treatments. So we want to address it in a specific way that needy people get homeopathic treatment where inpatient treatment is there. It will be addressed by the policy. As everything is required in effective protocol which justifies treatment, inpatient treatment, whether it's Ayurveda or anything. Because best part of Ayurveda and homeopathy is that even without X-ray, without much diagnosis, there will be a treatment. Like even my daughter underwent a massage treatment for her hand of 10-15 days, very effective. There's no X-ray, nothing X-ray shows. Like I was narrating a treatment of one person who had his spine bent. I don't think allopathy would have cured him, but Ayurveda cured. So wherever there is an effective treatment, it will be accepted by the policy. It has to be inpatient. So I don't think there are how many standalone homeopathy hospitals are there? Very few. If they have their line of treatment be given, if they make an application for empanelment, insurance company will review that, and see what line of treatment is given, how they can justify an inpatient treatment. They will empanel for a specific procedure with a cost. But that is a call insurance company will take. You have to convince the insurance company for empanelment. It will be done.
Yeah. Madam, sir, my question, I am Dr. Shesh Sai from Bangalore, Kalaveshra Ayurvedic Medical.
My colleagues from insurance company, correct me wherever I am wrong, please. Feel free. You are the people who have to take it forward, what I say. So if I'm saying anything out of place, where you feel there is a clarification, you can feel free and help me and also help them. Yeah, please, sir. Please go ahead.
Sir, myself, Dr. Shesh Sai from Kalaveshra Ayurvedic Medical College, Bangalore. So we have 220 bedded hospital. So reimbursement, everything is happening. So my observation is many times we used to receive feedback or complaint, whatever you call, regarding teaching hospital. For example, KPME registration we have done. It's in teaching hospital grade 4, wherein we have to conduct surgeries. So we'll be questioned how in Ayurvedic hospital the surgery can happen. So my question is continuation of Dr. Mrutyunjay sir. So whether the team members of that insurance company, whether they have some knowledge, awareness about the policy connected with KPME or connected with another question also we received like in about Vamana Karma. How you have done Vamana Karma in IP basis? Why you have not conducted that in OP basis? These all questions which really irritating, I think. So it has to be addressed from your answers. Thank you.
Okay, I'll address that. Again, going back to my colleagues from industry, correct me, but I'm going. See, the question, see, we will have not doctors everywhere sitting answering because they have call centers who take the intimation of claim. So what the questions they ask, sometimes to ignore them, give the information. Then there are people in the back end who will analyze and come back whether pre-authorization can be given. Some questions can be valid. So this can happen. Even I have personally gone through that for my daughter's surgery. It was a illogical question, but okay. They ask question, we send them, we send the claim form, she got the pre-authorization. So it may not happen always. There will be, and let me tell you, all are not experts sitting in the insurance industry where the intimation goes. Experts are sitting in the back end. But does it happen always? Stray cases. I mean, they question your line of treatment or line of this. I don't think they'll see the line of treatment. Initial questions. No.
No. I'll answer this. Because this is a very important issue because I also am a patient. I've gone through the process. See, I go to a hospital and everybody wants cashless. And even as you know, the regulator is insisting. Where is my regulator friend? Yeah. Regulator is insisting that 100% cashless. Am I right? So we are working towards that. So in order to do 100% cashless, first to that hospital has to get empaneled. If you are unknown person and you are sitting quietly in one corner and you are doing your business, how do you expect people to know that you are alive and you are kicking and you are doing good business? You have to be known. So get yourself empaneled. That's number one. Okay. And there is a big drive going on with GI Council to empanel as many hospitals as possible. On a month-to-month basis, we are monitoring कि इस महीने में कितने लोग empaneled किए जो empaneled नहीं थे. We are monitoring that. And IIBI is doing that. And I'm sure, my friend Dr. Mukund Kulkarni is listening to it. We are going to do that regularly. But the point which I'm making is what we are promising, we are not delivering. We have to deliver that. How do you do that? Awareness. So my proposal is GI Council should seriously think, along with the regulator, because without the stick, nobody listens. So regulator has to show the stick. Nahi karega, to tumhara kam. And the hospitals have to come forward to conduct awareness workshops. Like yesterday, I visited Apollo Ayurved in Bangalore. To understand that the people who are working there to process the claim of insurance, do they know what is going on? And what I am trying to do is what I found that there is a total lack of connectivity between the hospital staff who are engaged in supporting the insurance policy holders. There is a lack of awareness between building relationship with the TPAs, with the insurance companies and the brokers or the agents who are working here. In fact, I was expecting some people from the brokers and intermediaries also to be present here, but my friend Lokesh has fallen sick. Anybody has come? Anybody in this room from brokers and agents? No. And TPS, but a person like Lokesh, who is based out of Bangalore, he's fallen sick. He's unwell, so he couldn't come. I'm sure he's covered by insurance. But what I'm trying to tell you is that at the end of the day, we have to have that workshop, and which Rajiv ji has also agreed, and all my stakeholder friends have agreed. And GI Council in the next, executive committee meeting, we will take a decision that how we will go about doing this workshop in building awareness within the staff of all the hospitals to ensure that they know how to process the papers and get quick and prompt redressal in terms of reimbursement or cashless facility. Okay. Anybody from TPA? Anybody from TPA?
Excuse me, sir. Please. I have one question. Sorry, sir. Actually, I have one question for Shashi, sir. It's more than a question, as this is a sensitization program. Being an Ayurvedic surgeon and urologist, we regularly get a claim rejected, stating that even recently, that you are not a medical practitioner, or you're not supposed to, or you're not authorized to perform this kind of surgery from different insurance companies. Actually, I don't want to offend anybody, as this is a sensitization program. So it is there in Ayurveda. The surgery is there since ages. Yes, so it is there. Yes, it is there. But sir, recently we get this kind of rejection letter from the company. So we have our own regulatory authority, licensing authority. They decide. So obviously our authority decides. They are our licensing authority. So they have given us the authority to practice whatever we have studied or doing. So this is quite painful for us sometimes. And especially as the way someone was saying that, it is quite painful and embarrassing when a patient gets letter that this particular doctor is not a medical practitioner that way.
We got the message. We will conduct this workshop to educate the insurance
So
companies.
for especially my request to GI Council to add this particular. Thank you.
Very difficult to answer this straight away. Let me check with my colleagues from the industry whether it's happening, why it is happening, what corrective measures can be taken. We'll check. We'll check.
Not to worry. We'll take up it. Yeah, we'll take it up and we will make sure that we yeah, we will do that. We will do that. Actually, poor things they don't know. I was also a poor person. I didn't know. Thanks to Ministry of Ayush to get me involved. But what I'm trying to tell you is that we have to educate everybody. No, don't think that everybody knows everything.
My question is the different patients. Yes. See, empaneling is okay. When I go as a patient to any hospital, first thing they ask insurance. Yeah, you told. Okay. After giving the insurance, the prices are enhanced. Is there any system to audit that? Because though the patient is not burdened, even the patient is also burdened. Suppose 1 lakh bill has happened. 1 lakh bill has happened. Actual cost, it might be 50,000. They might have increased to 80,000. So instead of giving 10,000, patient will end up in giving 12,000 or 15,000. Company will end up instead of getting 50,000, 60 or 80,000. How to do this? Enhancement of prices, and also there are any system with any doctors, majority of doctors, with due regard, there is a possibility of giving some medicine when any other system. Say 10 tubes have been given, 10 injections have been given, they write, but actually might have given only 6. These are all the practical difficulties. Practical things are going on. Who has to, hen is first or egg is first? This is my question.
I'll answer that.
To answer it.
Yeah. One second, sir. First, I would like to stand up and salute you. Because in all the sessions, this is the first time somebody has raised this question in favor of us. It's always the other way around. Hitting us below the belt. Let me tell you, this is most, like he also, Dr. Mishra said, this happens day in and out. This is the reason we have problems.
No, sir, this has happened since about 2.5 decades after start of corporates. Don't mistake.
Our problem is that I'll tell you. Our problem is that today, if you get a reimbursement claim, the policy submission is 5 lakhs. He has paid to the hospital. There is a limit up to which we can scrutinize. He says, I have undergone treatment, I have paid. That is one big problem we have, because then we have to pay the claim. Court will not accept excessive costing. That is why, as Dr. Mishra said, if there is cashless empanelment of all the hospitals, this will not happen. So from day one, the insurance company will be in control of the claim. And most important aspect, which you probably have said indirectly, is that your sum insured goes down. You have a 2 lakh policy. That's normally 5 lakhs policy people should have. 2 lakh policy. If excessive billing is done, you have balance sum insured is less. Unfortunately, if somebody in the family again falls sick, you don't have that balance sum insured, which nobody looks at, because everyone is a customer. A patient is in a hurry to get treated and go. So nobody questions the hospital for any excessive billing. Those who question, we have seen the billing comes down. We question where there is glaring and we feel that it's not reasonable. But believe me, it's not easy. It's not easy. Like my colleagues can clarify the difficulties they have in questioning this. But cashless, it still happens in cashless, but the control is far better. And let me tell you, 90% of fraudulent claims happen only in reimbursement, because the file papers comes to us after 1 month, 2 months. By that time, it's over. So it's a good thing which you raised.
No, but the point he raised was, is there an audit that happens?
It happens, but
that with the patients comes to know.
No, audit, you are saying audit of charges levied by a hospital. Today, an hospital is in my panel, I can audit.
I was charged, for which I signed on it. Is that going to be possible?
You mean in cashless or in reimbursement?
Cashless, see,
Reimbursement, he knows. Cashless, we will tell. Okay. Let me. Okay. See, you will know, sir. I'll tell you how. You'll know.
Some solution has to be found. That's all.
We will have a question and answer session post lunch. So we have some online participants also who have raised few questions. So we'll take up the questions post lunch, sir. We'll address it post lunch. So moving forward, please join me in extending a warm invitation with great respect to a distinguished and esteemed professional, Sri Arvind Varshasvi, sir, Managing Director, Sri Tattva. Since we are running short of time, I will keep the introduction very brief. Sir is an eminent industrialist, an Ayurveda enthusiastic, and a successful entrepreneur. He currently serves as a Managing Director of Sri Tattva, an organization committed to seeing happy, healthy, modern world through the ancient science of life and well-being. Over to you, sir.
Guru Brahma, Guru Vishnu, Guru Devo Maheshwaraha, Guru Sakshat Param Brahma, Tasmai Shri Shri Gurave Namaha. Respected dignitaries on the dais, Professor Abdul Nasir Ansari, Director, NIUM, Professor Ghulam, who actually very nicely brought out what the entire institute here does, my very good friend, Professor Bijon Mishraji, Dr. Kaustubh Upadhyay, again a very good friend, Mr. P. Shashidharan, who's been enlightening us from the last half an hour, extremely informative as to what you've been addressing to us. Dr. Major Mukund Kulkarni, the head of health of IIPI. Also, Mr. Sukesh Kumar, DGM IRDA. Another very good friend, Sri Srinivas Luchi, the Honorable Commissioner, Department of Ayush, Karnataka. Dr. Debashish Panda, Joint Advisor, Ministry of Ayush. Ladies and gentlemen, my good friends of the dais, people from the media, and also our own very own doctors of the Ayush fraternity. It's a pleasure to be here with all of you here. I've actually been listening to a whole lot of stalwarts on the stage and also these questions that have been put up. And what really comes to my mind is that today in this day and age, it's extremely important for us to realize that what is the core of what we're discussing here today. And that being that we need to understand that it's no more pathy-centric, whether it's allopathy or the Ayush systems, but patient-centric. What's relevant to the patient at that particular point in time? And what does the patient require at that point in time in his life with regards to healthcare services? We've seen that the entire insurance industry has been empowering the allopathic sector. And like my good friend, Dr. Kaustubh Upadhyay also mentioned that right from early 2000s, the Ayush systems has also been empaneled as a part of the general insurance matters. It's important for us to get educated. I feel that that's extremely important across lines here today, whether it's with regards to industry, whether it's with regards to what the regulatory bodies are doing, whether it's with regards to patients or whether it's with regards to doctors. I find that there's a major gap in seeing that each and every one of us needs to get educated as to how is it we are going to be serving the patient. This line is extremely important, that how is it we are going to serve the patient. Like, for example, as what Bijon Mishraji also mentioned, that it's actually clearly mentioned by the Supreme Court that everybody has. Is this better? Check. I think there's a lot of, is this better? Check. Yeah, that healthcare is extremely important for everybody and everybody has a right to access it. But it's also important that it's done timely. And I feel that a whole lot of this timeliness can be resolved by technology today. All our hospitals, whether, like our institutes, we're also NABH accredited. We have a whole lot of, whether it's with regards to the products, our products are also coming across from units that are WHO, CGMP, COPP certified. So a whole lot of this comes with regards to certifying and also quality control systems, but also softwares today, saying that each one of the hospitals here have their own HMS, we see that a whole lot of data is being collated. I have my very good friend, Rajiv ji also here, who's been championing the cause of good quality data collection across fraternity, and he's also championed that across the entire sector. This is something that's very important. I feel that is the missing ingredient across, whether it's with regards to the regulator, whether it's with regards to the patient coming in, claiming their insurance policy, or with regards to how the hospital is actually delivering the insurance capability that what the patient has at that particular point in time. So I feel that perhaps from the regulatory front, and this is just a suggestion, saying that while we do have a platform like Rohini, where we have a great repository of where people could find in hospitals and also hospitals that are empaneled with insurance, I feel that when Dr. Major Mukund Kulkarni said that they're going to come out with a plus version of the entire software, perhaps a little bit more in terms of how information could be shared with insurance companies through an API or certain methodologies whereby it need not be only through emails or with regards to the HMS being working on something more current, something like as easy as how a person would pay a particular transaction through UPI. So we see that with regards to what treatments they're what are valid and what they can actually claim at that particular point in time, even while the treatment is going and happening. I feel that these would actually help the insurance claimants to see that how their insurance could be claimed faster. One more important thing that what I would really request the regulators, hospitals, and also our colleges, that we need to have regular sensitizing program for people to get insured when they're young. Because today we've seen that it's a day and age of technology of AI, and I would urge that even the core committee considers that a whole lot of technology could be inbuilt into this particular system so that the patient does not need to wait in queue at the hospital to get their insurance claimed. So I think having said these few words, it's been really enlightening to listen to all these wonderful people here on stage, and also thank you all for also bringing across so much in terms of questioning what's relevant to people at today's day and age. I find that extremely enlightening. It was very educative for me too. And I feel that there's a whole lot that what we could learn. But this much I can tell, at least the regulators and also the insurance companies, that the Ayush systems are something of the future. We've seen that there are a whole lot of matters with regards to lifestyle disorders taking over the world. We've seen that India is also perhaps becoming or already become the diabetes capital of the world. And all these things could have a lot of impact on the future of health of our citizens. So the Ayush systems do have a lot of solutions when it comes to lifestyle disorders. And here, why I'm saying this is because it's a whole lot of how you take care of your health on an ongoing basis. So I would also request the regulatory bodies not to look at the Ayush systems with the same glass of that of the allopathic systems. There might be a little bit change in perspective and also how we engage with these particular systems and see that how solutions could be arrived at. It's not a one-day job. It's not something that would be committed over a particular conference. But I think that over the year, with such wonderful stalwarts coming in, whole lot of solutions could come across to the system. Congratulations to everybody and the organizers. And once again, thank the Ministry of Ayush and particularly Dr. Kaustubh Upadhyay for having me here. Thank you very much.
Thank you, sir. I'm confident that these insights will offer valuable perspective in the advancement of our sensitization journey program. Now, it's our great privilege to honor to have Sri Srinivas Sir, IFS Commissioner, Department of Ayush, Karnataka, as the chief guest for today. Sir has significantly impacted the Indian Forest Service. Sir, in his capacity as Chief Conservator of Forest, have made exceptional contribution to the preservation of Western Ghats. Sir, we are privileged to have you here with us. I kindly request to address the gathering.
Yeah, good morning, everybody. Professor Mishraji, dignitaries on the dais, and most important today, all the doctors and experts from insurance sector. I was watching both doctors and insurance experts deliberating and holding on their expertise in addressing the issues. I think during the course, Mishraji brought out one very important point where insurance, we take insurance not to claim insurance. This we really need to appreciate this, understand this point. Everybody sitting here would have life insurance covered. How many wish to take life insurance? Nobody. But it's simply covered to cover the risk. Similarly, health insurance is one. Why do we really insure? I think that is the point really we are missing here. Simply we are talking about numbers, claims, and other things. Why do we want really insurance? Have you heard Diego Maradona insuring his left leg? Why did he insure? Why company was agreed to insure his leg? Now, many people, when you visit abroad here and there, you see the Western world is run by insurance companies. Your health is insured, your life is insured, your job is insured, many times your house is insured. Tell me which is not insured. Almost everything is insured. What do you understand by this? I think we are missing this point. The point here is, if something is insured, that means it is standard. It is standardized. Risk is covered. Okay, people have trust in that. That is the point. It is nothing to do with money. It is nothing to do with profit. Maybe insurance companies may be making profit out of that, but these are big organizations. This is a vertical for them to run this organization. Okay, it is not an insurance company just for making insurance. Nobody will create a company. Here, I have 2 points. One for my Ayush department, and another point for insurance experts here. First, to my doctor friends here. Today, when insurance people are coming and then discussing, my Ayush fraternity should take this as an opportunity to promote Ayush. Because why Diego Maradona insured his leg is, let whole world should know that that is the most valuable leg of the whole world. That is why that is, it is branding. When some big airlines gives you insurance, it is not that it is risking your life. It is giving you assurance. That is the inner message behind insurance. Now, when insurance companies are coming, like today we are talking about sensitization program, my Ayush friends should really take it as an opportunity to brand Ayush health system. Sorry to inform you, I myself as health commissioner, as Ayush commissioner, have visited a Ayush hospital only after I became Commissioner Ayush. Till that time, I myself was not aware that there is a Ayush hospital and which provides treatment and people can take benefit out of that. I myself was not aware. Think of a common man. That is the reality of the day. When that is the reality, please, when somebody is telling Ayurveda, don't think it is only for Ayurveda. If somebody is telling Unani, it is not just for Unani. Ayush, everybody is one. For some name, they may be taking Unani, some name they may be taking Ayurveda. So, when homeopathy doctor some raised some issue, some Unani doctor raised, I was wondering why you people are thinking so mean. Ayush is one. Ayush is a bigger umbrella. So take it in that perspective and then discuss and debate with insurance companies. Second is, in fact, the important thing in insurance is number game. It's number game. Game of data. If the more people are taking the benefit, the premium will come down. It is as simple as that. So if Ayush department has to encourage more people to get the benefit of this insurance, first thing, the biggest lacuna in Ayush department today is what? Database. We ourselves don't record how many people visit and how many people take benefit, and the collating that data management is very poor here. We know that. If you ask me as Ayush commissioner, how many people visit, in the whole state, I try to, it's very uncomfortable question to me that how many real people visit Ayush hospitals and take benefit. That is the reality of the day. Okay. Now, who has to generate this data? Who has to generate this data? Ayush system has to generate this data. Not necessarily government actors, including private. Okay, because Ayush is a system. Government and private this is simply we have created for ourselves. Ayush do not differentiate between government and private. So both government and private facilities in Ayush has to formulate a plan of creating a database of actually how many people are coming, how many people are taking benefit, and how many people are, what is the cost that they are incurring for kind of a thing. So we have a big learning for this. This is a take-home message for all Ayush big wigs sitting here, that rather than talking to insurance people, first let us ourselves build up a system to generate data. The minute we do that, others will follow. Kabil, there is a beautiful dialogue, no? Kabiyat bano, काबिल बनो, बाद में इंश्योरेंस आपके पीछे आ जाएगा. ठीक है. Second is, this is also an important opportunity for Ayush sector to standardize things. I was hearing somewhere here and there, one treatment somebody charges in Mysore, one system charges 50,000 per day, and parallelly there is some other system charging 500 per day. Okay. Now, it is not for insurance department to correct it. It is for Ayush sector to correct this. Okay. Now, you standardize your treatment procedures. You standardize the cost of each kind of a thing. Maybe plus 10-20% will always be there for deluxe room के लिए अलग होगा, luxury room के लिए अलग होगा, वो सब रहेगा. But otherwise, overall, there is a sense standardized treatment procedures and standardized protocol and standardized cost. So that it's an opportunity for health, Ayush sector to take benefit of this sensitization program to correct our house in order, so that the benefit of insurance will be covered to more people. Next, I have small thing to insurance department also. So we all know everybody insure their car. But how many people after car met with an accident actually claim your insurance? Very difficult. Very difficult. So it has its own issues. Similarly, Ayush sector is aging sector. Okay. Though our history is, we say, thousands of years, but only recently we have standardized. At least I appreciate NCISM when it comes to standardizing Ayush education system. Today, a few years back, somebody who has magic in his fingers can claim he is a Nati Vaidya. Today, that is the case. unless otherwise you undergo 5.5 years of this, 2 years of PG, register KUP, you cannot practice. So a lot of effort has gone in standardizing the education system of Ayush. Somewhere standardizing the treatment aspect of Ayush is still, there is a big gap. Okay. So I think, it is for the policymakers and the Ayush department to, put forth same, seriousness in standardizing the treatment protocol of Ayush system, so that, insurance things also will be covered. Then when it comes to insurance, again, insurance is a very big sector. Okay. And Ayush is an emerging child. So, I request this sector to give the benefit of doubt, at least for, probationary period. Okay. Probationary period of some 5 years. So that till 5 years, you don't ask too many questions while empaneling, while standardizing, while claiming, kind of a thing. Slowly, once, things stabilize, then you can, put forth more and more regulatory roles, regulatory stringent conditions, so that Ayush, like allopathy sector, can come to a stage where they also will be in a position to answer all your queries, and then, stood on ground. So that is also a problem. So I think, these are these, two simple messages that I wanted to convey. And then I really like this term sensitization program, because Ayush department really needs sensitization of all of us when it comes to how to do business. See, insurance is not charity. I think the chairman really mentioned it is not charity, it's a business. And unfortunately, Ayush do not know how to do business. Traditionally, we are Nati Vaidyas, and I have, we take pride in telling, well, I treated somebody, I didn't take anything from him. We take pride in that. Okay. Yeah, that is there in our genes. Okay, that is there in our genes. Slowly, but charity cannot go for long. Slowly, we are coming out of that shelf of charity and standardizing our education system, standardizing our treatment things. So slowly, we will learn how to make business also, and then how to corporate, Ayush system of medicine, so that, all insurance is a corporate sector. Ayush is not still, it's a family kind of a thing. So we are learning our lessons of getting into corporate culture. Till that time, I think I expect insurance sector to give that benefit of doubt, and then keep us under probation for 5 years. I'm sure in 5 years, our doctors are very smart fellows. They will learn the trick of the game, and then they will come to the expectations what insurance sector is really demands. So in that respect, I seriously appreciate the Government of India for organizing this program and touching this very, very sensitive subject, through which we are all sensitizing all of us, and this sensitization is very much required for promoting Ayush. Forget about how many people really claim that claim the insurance, but this is also an opportunity for all of us to promote Ayush. That is the need of the hour, and I really thank organizers for giving me this opportunity to share few thoughts. Thank you.
Thanks for your insightful words, sir. And thanks for bringing up the take-home messages, emphasis on the importance of creating awareness, generating data, and standardizing treatment protocols. As we near the conclusion of the morning session, we will continue the sensitization program in the afternoon also. So now it's my privilege to invite Dr. Debashish sir, Joint Advisor, Ministry of Ayush, to propose the vote of thanks. Kindly come over, sir.
Thank you. Good afternoon, everyone. Respected dignitaries on the dais and off the dais, my dear friends and colleagues. As we know, today, Ministry of Ayush has organized the third sensitization program on empanelment of Ayush hospitals for insurance coverage and documentation process for insurance claims. Ministry of Ayush has already organized two sensitization programs previously. First one at Institute of Training and Research in Ayurveda at Jamnagar, and the second one at All India Institute of Ayurveda, New Delhi. And I'm very happy to share that the journey so far has been so much amazing and successful. Now, as we conclude the first half of the today's program, let me take this opportunity to congratulate and thank all who are involved in the successful education of this sensitization program. First of all, I would like to pay my sincere regards and gratitude to our dynamic Secretary, Minister of Ayush, Vaidya Rajesh Koteja sir. Though he is not present here because of his busy schedule, but his guidance and support is the base of this event. And his blessings and ideas have done the ice breaking. I also pay my sincere gratitude to Sri B.K. Singh sir, Joint Secretary, Minister of Ayush, for all his support and guidance. And I'm very much thankful to our and pay my sincere regards to Dr. Kaustubh Upadhyay sir, Advisor, Minister of Ayush, under whose dynamic leadership we managed to make this event successful. Sir, your words today are truly enlightening and worth remembering. Thank you so much, sir, for your advices and mentorship. I would like to take this opportunity to thank Professor Bejan Kumar Mishra, sir, Chairman, Core Group of Experts for Insurance under Ministry of Ayush, who has been a true spirited and positive part of this journey till now. He has guided the whole team, helped us in every step of this journey so far. Sir, today your speech was really articulate and eye-opening. I present my sincere gratitude for all your efforts and dedication, sir. I would also like to acknowledge the hard work and dedication put forth by the member core group of experts for insurance. I pay my deepest gratitude to Professor Mukul Patel, sir, Mr. Rajiv Basudevanji, Professor Narayan Sahane, sir, and Dr. A. Raghu, sir, though he is not he is present online, for all your efforts and dedication. I also pay my gratitude to our chief guest, Sri Srinivasul, sir, Commissioner, Department of Ayush, Karnataka, who has given his valuable time and graced this occasion with his auspicious presence. And thank you so much, sir, for your heart-touching and insightful address. I'm also thankful to Sri Aurobindo Varchoshi, sir, Managing Director, Sri Sri Tattva. You are also incredible today, sir. Your insight is impressive and your words are encouraging. I pay my most humble regards to you. Now I want to thank Professor Abdul Nasiri Ansari, sir, Director, National Institute of Unani Medicine, and his team, particularly Dr. Muzaffar Ahmad Bhatt, sir, for successful organizing the event. Your hard work and dedication are praiseworthy. I would all the supporting staff of National Institute of Unani Medicine who have arranged everything and provided the much needed help to make this event memorable. I also thank Professor Gulamuddin Sofi, sir, for his presentation. Truly the story of NIUM will motivate all of us who are sitting in this auditorium. Now I pay my sincere regards to Sri Sukesh Kumar, DGM, IRDI, Dr. Mukund Kulkarni, Head of Health, IIBI, and Mr. Sasivaran Nayak, sir, Head Technical Health, GIC, for being an integral part of this sensitization program and for their insightful presentations. Your support and active participation in these sensitization programs are truly commendable. I also pay my gratitude to all the representatives of general insurance companies for their active participation. Sir and Madam, your presence is truly noted and appreciated. And of course, let me take a moment to thank the representatives of media who will give the platform to reach out to many people. I pay my most sincere gratefulness to you guys. I'm also thankful to Dr. Kusum Thapa, Research Officer, Minister of Ayush, and the entire team of Dog Policy Section for their untiring efforts and support. Last but not the least, let me wholeheartedly thank one and all sitting in the audience and participating Our actual aim now I will conclude. I can insurance, and that will be the real achievement for all of us. There would be another session post lunch, and lot of valuable presentations are awaited. I am very much hopeful that we will make a good use of our time and get benefited from these presentations. Thank you. Thank you all.
Thank you, sir, for your expression of gratitude. Now, may I request everyone to stand up for the national anthem as we are concluding section.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you. Thanks everyone. Now we will have lunch break and we'll rejoin after half an hour.
So let us see the documentation for the pre-authorization purpose. So what is the essential documentation which are required for sending the pre-authorization document? So in this, basically, first thing we have to look at the pre-auth form. So the pre-auth form should have complete and accurate information in terms of the duration of the presenting ailment and the past history, total estimated cost. So here basically the present ailment, the duration of the present ailment is required for the policies. In terms like there will be a waiting period for under the retail policies. To understand that, we always have to capture the accurate information. Then we'll be talking about in detail about doctor and physician summary, what are the things to be captured, and like presenting complaint diagnosis, medical report information, detailed treatment plan with number of days, and justification for the inpatient hospitalization. And again, the third point is medical reports. Always we should capture the medical report information respecting to particular diagnosis, what we are trying to show in the pre-authorization form. The next document will be like insurance details, like the policy copy or insurance card. Then the patient ID proof, insured ID proof should be provided along with the documentation. And when it comes to estimation, we need to provide detailed breakup of overall charges for the total estimation. That includes like all treatment charges and then room charges, which has complete information in this. Then the next point will be like KYC form. For the cases which are more than 1 lakh, we need to provide the KYC form also. Then we need to understand even the communication to insurance company. So there are certain insurance companies which go through portal upload, and there are certain insurance companies which will be accepting still through email mode. So always we have to follow the instruction given from insurance company for the faster process. So it's like if you are able to upload the document in insurance portal, which will speed up the process and it will be useful for insurance company to decide the case on priority. So I'm just taking a sample document of a pre-authorization form. So here we are discussing about a Niva Bupa insurance pre-authorization form. Basically, the first information will be the hospital information, which is the hospital and which is the. Then when it comes to the, so who is the patient who is getting admitted and the insured details. So we need to capture their date of birth and then contact information and whether they have any other policy, existing policy with them. So this is the other part. Then next comes to treating doctor details to be filled. So what is the what is the treatment, and what is the number of days? And again here it comes with duration of the ailment. So what is the duration of the ailment from when this condition is persist? And then what is the diagnosis? Along with diagnosis, we need to capture the ICD code. Presently, insurance companies are going with ICD-10 code. So we need to capture complete ICD code for the particular diagnosis what we are showing. Then it will be like medical management, and if it is, as we all are from IS department, so we'll be going with non-allopathic treatments. And the other part which comes here again is route of drug administration, oral and external treatments which will be there. Then we are not doing any surgical case, surgical in this particular cases. So what are the information, whether it is an accident case, that complete information to be given. And then next the part is details of patient getting admitted and what is the number of days when the date of admission, and what type of the room has been patient selected. And here we'll be having per day room cost including the nursing charges. And if it is any other package, you can put it in the total less total estimated package for the total treatment. Then the declaration from hospital along with the hospital So we're going to next see like similar kind of pre-authorization form for HDFC Argo. So here again, it's a similar factors which are to be taken through the patient information, and the next information will be about the doctor, and then the treatment what has been undergone, and from when the duration of the for all pre-authorization form. I'm taking one of the TPA. So here again, the pre-authorization form will be first thing we have to capture and insured information. Then comes about the treating doctor and what is the then say similar option for so we have another pre-authorization form from TPA Vidal Health. So it's again similar. I'll wrap up through. Here is again important thing when it comes to physician summary or a doctor summary. So for every case, we need to provide a complete information for insurance company to decide the case and speed up the process. For an example, for this particular case, we have to capture patient information, then age of the patient, and then UHID. Then when it comes to presenting complaint, so we need to give complete information what patient has told. For example, it's a knee joint pain bilateral and swelling over knee joint pain. So we're trying to the medical history. And then the character, the description of the whether activities are and basically like this and we are going next is associated symptoms like any other symptoms. And then we again go back to also which like for other medical. So we need to declare that complete information. Then the current and past medical to clinical examination finding. So in the general and specific particular thing, specific system, joint tenderness, whether swelling or next and presently in this case, then again or Delhi will have a different treatment protocol. So it always depends upon particular thing. Then other important so for an example here we are taken in OA case, there are some sample treatment lay pump, bandage, and certain set of treatments which will be followed for total number. And for this particular treatment, like we need to justify what is the need for why the next is whether patient is and the lifestyle and medication requirement. And this document the conclusion of this, always when we mention about an Ayurveda terminology, we need to provide equal next is enabling here I'm going to take you through like what is the documentation required for an health claim reimbursement when the patient has taken treatment and then submitting for the reimbursement. So like first thing is claim form part A to be filled by insured. So the details of primary insured who is insured in the policy and details of insurance history, details of insured person who is hospitalized and which hospital patient has got admitted and what is the room category, date of admission, date of discharge, and the breakup of pre, post, and the hospitalization complete information has to be provided. Along with this, patient has to attend. Then the next thing will be and the third point is report. Then along with the next point, and other thing is details of primary, then signature and patient has to. So this is for insurance company to verify the genuinity of the claim. Thank you. Any questions? Answer. That.
Hello.
Thanks for the presentation, sir. Now we'll move on to the question and answer session. So we'll first take the questions from the participants online who has joined online.
wants to ask, yeah. You come in the front, all of you come in the front. It takes a lot of time for people to reach you. Yeah. Come in the front.
May I request the online participants? Janath R. Sir and Dr. Srinath and Mr. Biswajit Sir.
Yeah.
May I also request Mr. Praful D. Sheth Sir, former Vice President, International Pharmaceutical Federation, to join us. And also I request Professor Abdul Nasir Ansari Sir, Director, to join us on stage.
My question is, can I ask?
Yes, sir, please. Sir.
Yeah, my question to Dr. Manna sir. So this is regarding case history, the details, which is usually the demand from the insurer company, and sometimes we receive the information through the patient. Whether we need to give the complete case history details through patient to reach the insurance company, or we need to mail it or whatever other sources to the insurer.
So this is you're checking through and for a cashless case or reimbursement?
Reimbursement only.
Reimbursement always we have to provide it to patient only, because patient has to coordinate with the insurance company.
Okay.
So any kind of justification, usually like insurance company comes with what is the reason for prolonged stay and what is the need for inpatient hospitalization. So such queries has to be provided justification addressing to insurance company, but we can give it to patient.
So you mean a complete file, case file can be given to?
No, usually like the treatment record book will be there, no ICP papers, so that can be given.
Okay. Thank you.
My question is,
yeah,
if we do the first session of treatment in osteoarthritis, if patient won't get complete relief, can we repeat once again? In how much time we have to take the interval? And one more question is, if the allopathy side osteoarthritis is recommended for knee replacement, can we go for Ayurvedic treatment?
Definitely, when it comes to such cases, yes, it has to be treated. There are cases where like allopathy will be referred for a total knee replacement. When patient comes, yes, which we can help definitely, and then we do treat them. And the number of days has to be decided by doctor. If doctor feels whatever it is required, the physician has to confirm that. So as per that can be gone.
The insurance TPT will accept that case if we do the Ayurvedic treatment.
It again depends upon case to case. We have to give a justification. What is the need for hospitalization? What is the need for the treatment?
No, he is not interested to take total knee replacement.
Yes.
You want to take Ayurvedic treatment, they will accept or not?
Definitely they will accept it.
So how much interval?
See, you don't begin, if I may answer here, you don't begin with the presumption of interval, right? Basically, you're trying to do treatment to solve the issue.
Usually osteoarthritic cases
depends on the condition. So if it is very, very grave, where surgery is indicated and conservative Ayurveda management will not be sufficing, then you have to indicate for that. So which is why we have to bring in a lot more precision into our claims and one more question into our documents that we submit. So there is no black and white answer. The patient is making a choice that he's got severe knee pain, osteoarthritis. He or she would like to prefer to go for Ayurveda. That's it, right? Now, the Ayurveda doctor also sometimes may, even if the patient is indicated for surgery due to whatever severity, may still say, give an assurance I'll treat it through Ayurveda, and after a few months it is recurring. But I can only tell you that from our experience over the last close to 2 decades, the number of people who go for surgery immediately in the near future is, I can't remember the cases like that, right? So which means we are able to distinguish between those who will benefit from Ayurveda treatment and who need to go for modern medicine. Right? That's my answer. And to your question, Dr. Seshasai, see, the documents are specified by each insurance company and TPA. What to do in a reimbursement claim, the list of attachments is clearly mentioned. According to that, you have to do. So what is required from an Ayush hospital is to put in place a department, a team, which gets trained in this process. Then they know this PPA, this insurance, what I should submit for pre-authorization for a reimbursement claim. Right? It's a process of learning, and you should invest in it.
My question was, to patient, can it be given or because
So reimbursement, he's going back. He's going back, and then he's doing it. But to be factual, hospitals also aid the patient in the reimbursement claim process by telling, okay, you sign the documents, finish everything, and we'll send it by courier to the insurance company. Mail from the company means I didn't get. For a reimbursement claim.
Yes, for reimbursement, sir.
So reimbursement claim you are submitting or the patient is submitting? Patient is submitting, but the query comes to you. Yeah, correct. So what is the question?
No, instead of giving to patient, directly we have approached the company.
Oh. You would like to answer?
We are very fortunate that the regulator is also sitting with us. There are certain norms which the regulator has made. And the norm is very clear that the insurance companies will deal directly only with the policyholder. Simple. Okay. If you try to break that rule as of today, nobody will listen to you. I get mails because people approach me that मेरा ऐसा नहीं हो रहा है, आप क्या करें, आप बताइए and all that. So I write reply to all to ask क्यों नहीं हो रहा. I get a prompt reply from the insurance company. Who the hell are you? We don't want to listen to you. Let the patient tell us, and then only we'll listen. So now I'm telling the regulator who's sitting in front of us that you at times you need to change certain rules and regulations to make it little more friendly. But the point again is the insurance companies, unfortunately, if they open the floodgates, you don't know how many people they will deal with, who they will deal with. So they have always made it a point to deal with only the patient directly. Because anybody can come and say, I am, हमको copy mark किया, so I am coming. अरे copy वो तो Prime Minister तक copy भेजता है. You see, so there are people who copy all. So you have to be very careful that you educate the patients to take it forward directly with the company. The way the company wants it from the patient, you help him to do that. Simple. Am I right? Could you understand? Yes.
Sir, I have just one
Who is
question.
this?
I am bothering you again.
अरे
I am
यार,
bothering you again.
एक बार तो पीछे छोड़ो.
Number one,
just 1 minute. I am not telling anything. Let Somashekar has not spoken from the morning. He is desperate to ask something. Yeah.
Just wanted to supplement your statement that even in banking ombudsman RBI, there is a column. You fill it up. They ask you whether you are representing yourself or the client.
Correct.
These days. Now, if you tell them, are you an advocate? And if you are an advocate, if you are a self-advocate, that is on your own, you have a case, you can represent. If you say, yes, I am an advocate for somebody, they reject it.
Correct. So even in the insurance ombudsman, they insist that only the patient comes directly to the ombudsman, no via media and all that. And including the insurance companies also, they cannot engage any lawyer and all that before the ombudsman. They have to have their own staff to go and represent before the ombudsman under the Insurance Act as per ombudsman. So yes, now,
So can those ways of diagnosis be accepted by the insurance companies? Because we don't realize, sometimes we don't realize.
Insurance companies will always agree to a standard or a process which is being not only accepted globally, but also in India under certain norms. Okay. You can't say, I do like this, you better accept it because I do it.
Now we have
the supreme.
We have the case of vitiligo, for example. There are no diagnostic criteria available. It is just we see the patient, he is having the patch, and we start the treatment. How can he claim that?
See, whatever the criteria for diagnosis, as per the system, you can mention it, and it is agreed. It's
Thank
not
you.
an issue. It's
Thank
a
you.
purely technical issue.
Thank you, sir.
But having said that, I think it helps everybody in the process, right? By being proactive and using terminology which is understood by all. So there are certainly international definitions, classification of viticular types, severity, stage, and all of that. Take photographs exactly so that there is some visual or documentary evidence to establish what you're claiming. So while you take your Unani system of medicine or Ayush system of medicine and use your logic there, I even encourage you put the translation in brackets when you use a term, the closest you can come to, because we have to understand it is our effort to build bridges with the other side, right? So let's be proactive. That is why the doctor's summary itself is made up, right? What you saw, you notice it is not part of the insurance pre-authorization flow, but we should do it proactively.
Anybody from online, if they want to ask question, please come.
Sir, I have one question regarding the 2-3 claims of rejection. One case is Kadishula lower back. The case 100% success with all full with evidence and submitted the form to the company. And after the rejection, they are mentioned the need for admission could not be justified. I repeat, need for admission could not be justified. The patient was admitted without walking. It is a severe pain and with full evidence. And they said the treatment can be taken on outpatient base. No need of IP. This is the one case. Another case is a cervical spondylitis, a grievous samba. And patients are came there and full certified, justified. The claim they are sanctioned only 25%. And they mentioned that our treatment procedure is not need at all. Then what is the job of our doctor here, sir? So this is some understanding regarding the guidelines of the OP treatment coverage. As mentioned before, in order to extend insurance coverage to include outpatient treatment, we are requesting to board to create through a specific list of disease that would be covered under this provision. So what is the benefit, sir? We can already, Mr. Raji also mentioned that we can the dialogue with the patient. Now what happened? We are already given all the payment also submitted. We are not getting the payment.
Sorry.
So this is a relationship with hospital and patients, sir. Some complications are raised. How can to solve this issue, sir?
Yeah, thank you. Thank you. Very relevant question asked. You see, the point which I would like to make is, as per the redressal mechanism under the Insurance Act, if somebody is not happy with the settlement of the claim, that person is free to approach the ombudsman as per the guideline and the law. And also as per the natural justice prevalent in our country under our constitution, anybody is free to challenge any kind of a decision which is seen to be or deemed to be unfair and not as per our constitution in terms of the rights of the citizens. So please get it very clear in your mind that you have a redressal mechanism where you go to the court of law and you can seek justice. But I also want to tell you all with the same breath that individuals or patients would not like to go for litigation easily in our country because our legal system is very cumbersome, long drawn, and very expensive. I think no lawyers are sitting in this room, but they are as expensive as don't laugh, you doctors are also very expensive. So what I want to tell you all is that at the end of the day, so we have to do certain precedents. We have to put certain precedents. I've asked ombudsman. You see, I've asked ombudsman that how many cases have come before you where the patient has felt that unfair treatment was done to them in terms of settlement of their claim. Not even, I don't think any ombudsman told me they have received any complaint. Now, what I want to tell you, who has asked the question? Ramnathanji. Oh, Ramnathanji. Oh, Ramnathan.
Yes, sir. Yes, sir.
You should have been in Bangalore.
Yes,
Why
sir.
are you sitting at home? Arey, you should have come here. Anyway, what I want to tell you, Ramanathanji, we have to start doing, precedents. Go to the Consumer Commission, go to the Ombudsman, go to the High Court, go to the Supreme Court, and wait and fight on the behalf of the patients if you are so confident that we will win. I'm there to support you, but you please don't give up if it is genuine, because we are not creating precedents. You create precedents, you will see everybody will wake up and they will start treating in the right manner. So if you get it's granted, nobody will listen to you. You have to be Jago Grahak Jago.
Similar thing happened. In December, Madras High Court has given the judgment for this equal treatment to all systems from the insurance companies. Because of that judgment only, IRDAI has come out with the, it was in the policy flow from the earlier also, but it was one of the main reason where we have come out with the proper direction that it should be implemented. So like this, if somebody takes active role in questioning any unfairness or any malpractices, then it will set a precedence to lay down good laws and good procedures, good practices.
Yes.
But online also they can unmute and.
Sir, certain Ayush therapies are OPD basis, where per margin chikitsa just like. So such, sir, myself, Dr. Lingareddy M. Biradar, Principal Gramin Ayurvedic Medical College, Terra, Bagalkot District. The people
Regarding
visit.
to OPD treatment,
Yes.
actually morning already we have discussed this issue. Insurer, if they feel OPD treatment demand, the particular insurance company will design the policy. Otherwise, in general, they are giving preference to IPD treatment. But few policies, few insurance companies are covering OPD also. When demand goes from the consumer side, then they will think of introducing OPD coverage also. But it's all market driven. So your patient has to create demand for that. That's the only.
Okay, sir. Thank you, sir. Yes. Yes, sir.
Online, somebody wants to come in?
Sir, I am Dr. Pardasari, sir, calling on behalf of Department of Ayush, Telangana and JSPS Government Home Medical College, Hyderabad, sir. Sir, are you able to hear me?
Question, please.
Sir, in homeopathy, actually, we don't have any procedures like Unani and Ayurveda. And we will treat as outpatient basis only, but few people are reimbursing with our government, sir. And is there any hospital which is registered for claiming the insurance with you? Not only in Telangana, all over the India, pertaining to homeopathic system, sir. We want to know it.
This issue came up in the morning session also.
Yes, sir.
First of all, we should have some therapies we can which requires IP treatment in homeopathy. If we come out with such data and such justification, then we can put up that in the framework of the insurance. And I think already STGs, including homeopathy, we are creating. If inpatient treatment is justified, then that can be supported from the insurance agencies. Otherwise, till the companies require OPD coverage is essential. Till that time, homeopathy has to wait.
Okay, thank you very much.
Sir, Kaustubhaji, one more question, sir, regarding the rejection.
We can keep this for the next after one from the insurance company side. One presentation will be there on data basis. Afterwards, you can put this question, sir.
No, this is a correct myopia and a refractive error issue, sir.
That we have seen, sir, that we will discuss in the core committee. Totally,
Okay.
all this individual case by case discussion is not possible in this forum. That we
Okay,
can discuss within the ministry or within the committee, and we will decide on that.
Got it. Got it.
So we have some more questions, so we can take it.
Sir, we can raise the issue, the Rohini portal issue here, sir. Rohini portal. This forum is accepted the Rohini portal issue.
What is the issue with Rohini portal?
The Rohini portal last after the Delhi this meeting, some hospitals already started for the registration. That after the final registration, they are asking the remitting the
I
fee
have
from
received your
2015
representation,
onwards.
sir. Ramanathanji, I have received your representation. I am going to send it to IIB. They will address that issue, and the issue will be addressed in general for all the Ayush hospitals.
Okay, okay. I got
Definitely, it will be looked into.
So can we take one more question?
One or two questions,
Okay, sir.
important.
So one question was asked by Gayatri Bhatt. How many times the patient can claim the insurance? Because for Panchakarma treatment, one has to get admitted again and again.
In Ayurveda also, again and again doesn't mean every day, every month. It's once in a year or twice in a year. Or seasonal treatment as per the requirement. So it should be with justification, and there is no
can be claimed as many as possible times unless the sum insured is not exhausted.
Okay, sir. Thank you, sir. So before we move on to the next presentation, may I kindly request Professor Abdul Nasir Ansari, sir, Director NIUM, to present a memento to Mr. Manjunath, sir, Apollo Ayurved Hospital. Thank you, sir. May I kindly invite Dr. Srinath and Mr. Bisudit Amin from MediAssist to give a presentation on empanelment of Ayush hospitals and settlement of insurance claims.
A very warm welcome to the distinguished dignitaries on the dais as well as off the dais, industry colleagues and friends. Yeah. And also thanking Dr. Devashish Panda and the Ayush Ministry for giving us an opportunity to make a representation on Ayush empanelment process. So MediAssist is the largest TPA in the country, and we have close to around 18,000 plus hospitals in our network. These are primarily the allopathic hospitals, and a few of them also are part of the Ayush network. So why with IRDA coming up with this directive of including Ayush hospitals? Earlier there were government recognized Ayush network hospital, Ayush Ayurvedic hospitals, and some of the Unani hospitals which were part of our network. Now with the guideline coming from IRDA to include all the Ayush hospitals to be part of the cashless services for the policy holder. So this is the primary points that which we would wanted to put across. The importance of insurance coverage for Ayush treatments, which has to be defined by the as well as insurance companies to provide adequate quality and service across the Ayush network. Cashless hospitalization for policy holders in Ayush hospitals. Negotiated services which are the best in the market, and predictability of all prospective providers regarding their empanelment requests. So we have been getting a lot of requests from hospitals which are falling under the Ayush category, and we have been taking, depending on how the insurance company has put across the terms for getting these hospitals empaneled. So the process basically is how these are the standard empanelment process that we have set across for all our hospitals, and we being a TPA, we work with almost all the insurance companies. So when we take an hospital on our network, the terms are equal for all the insurance companies. For example, if we sign up for a rate, the rate is applicable to all insurance across the board. So when we start an empanelment process, we look at the locations where hospitals are not present on our network. Hospitals who send us requests for getting onboarded on Mediassist network. And then there are recommendations coming in from insurers, brokers, even corporates, where they require a certain segment of hospitals to be part of the network for getting their policy holders and their employees the benefit of cashless services. And self-responded hospitals where they proactively come and approach us for getting empaneled. The criteria for selection for hospitals is the minimum bed capacity, where in Ayush it is now 5. Otherwise, for all other hospitals, it is 15 bed criteria. Infrastructure, basically looking at all the different segments in Ayush, which will have to be looked into, and post the regulatory compliances and the accreditation. This is the documentation part, which is a primary requirement for any hospital to get onboarded. Mr. Sashidharan and Dr. Mukunda have already given us the insight in terms of what are the parameters required for getting an hospital empaneled, and the relevance of Rohini. Along with the Rohini ID, these are the basic documents which are required, mandatory requirement, wherein we sign up a MOU, a health service agreement, and a master service agreement with the hospital. We take the complete data bank of the hospital and their bank details, and then we create a HID template, the hospital identity. It's just like an Aadhaar for hospital. So they get a unique code where for every cashless claim that they submit, the HID has to be mentioned. And then the statutory compliances, PAN, the Rohini ID, the registration certificates, the fire NOC, these are all statutory documentation required. And then the photograph of the hospital and the GST number if the hospital has room charges above 5,000. So these are the documentation which are done with the hospital when the empanelment process starts. On fulfillment of all the documentation, hospitals are then onboarded onto Mediassist network, and then they are able to extend the cashless services. So this is all that I have to put across. And any questions pertaining to empanelment of the hospitals? Thank you.
Thank you, sir. Thank you for the presentation. May I invite Professor Bijan Kumar Mishra, sir, to come forward and present a memento to Dr. Srinath and Mr. Manjunath R. from Mediassist. Sorry, which means. Okay. Yes, sir, sorry. Dr. Srinath and Mr. Biswajit Amin. Oh. Sorry. Mr. Arvind. Now we'll have the question and answer session. About MediAssist.
That's already been told, and today we cater to. We service more than 22,000 corporates today, and we have offices across the country. Having, in a way, if I say, I can very confidently tell you that we service every third policy holder is serviced by MediAssist. No.
We will invite you to our sensitization program. Your
Sure, sir.
participation is important,
Sure.
and you have to guide our Ayush hospital to come in this program.
Definitely.
Come on.
Definitely.
And your presentation is wonderful. If I was knowing about your presentation, I would have fixed it in the morning session only.
Thank you, sir. Sure, sir.
Sir, regarding what is the fees, sir, the empanel, each in any empanel, fees is required. That is mentioned somewhere some fees. So we are already, Rohini portal is already fees, then every empanel is required for any fees, sir. That is a clarification is required, sir.
No fees required.
If they're asking, then you report to us. Okay.
Any questions? So I will give some clue based on the presentation of MediAssist. Given if you show somebody online.
Yes, sir. Myself, Dr. Mohite, sir. I am representing RKM Hospital, sir, Vijaypur, sir.
Please.
Yes, sir. Yes, sir. We are already empaneled with. We have a group of institutions, sir. Along with that, both Ayurveda and Allopathy hospital we have, sir, under the same roof.
What is your question?
Okay. We are already empaneled with most of the private TPS, sir. So for Ayurveda, we need to empanel separately, sir, or how it is, sir, or with the same this thing MOU tripartite agreement can be done, sir.
So you mean to say you treat patients of Ayush under the same hospital where you extend the allopathic services?
Yes, sir. Yes, sir. We have a teaching medical college and a hospital, sir. Along with that, we have allopathy hospital also, sir. For allopathy wing, we have already taken the empanelment, sir.
We can consider. We'll have to look into your documents once we go through all the documentation, and then we can give you an way ahead how to get the services included in the existing hospital name.
Okay. Is it only for MediAssist, sir, or for all the TPAs, the same rule will be applicable?
No, we are only I'm talking for MediAssist. So other TPAs will have their own rules and regulations for considering a hospital.
Okay, fine, sir. Whom to connect to the provider networking department only, sir, right?
Yeah, provider, same.
Okay, fine, sir. Thank you, sir. Thank you.
Sir, the NABH accreditation, we got all the certification, but your presentation, you are mentioned again, you want to file the fire building, etc., etc. Is it required, sir? The NABH completely full covered for 4 years.
No,
so for why
NABH
again it's required?
Documentation that you do.
Not clear, please.
Hello.
Yes.
Is the question to me, sir? Answer.
Yeah.
See, ours is non NABH hospital, sir. We are just preparing for the NABH.
Your
Sir.
question.
Not you. That is a empanel presentation.
I think he has already answered.
You see, what is mandatory, what is given in the law. If there is a law and it's passed by the parliament, then that is mandatory. Now, what the insurance company does is they have something called more than the law. Mandatory law is for everybody, but insurance companies have the right to give empanelment or recognition. Who is this? Yeah. So insurance companies have been given the freedom by IRDAI that you can form your own regulations in terms of empanelment, and you can go ahead earlier. Like for example, IRDA had given a recommendation that kindly consider NABH accredited hospitals more closely and give them that recognition so that they can also get incentivized in terms of their pricing, because they are NABH accredited. But now the regulator has removed that, and I think now it is voluntary. These are voluntary initiatives. If you want to do your hospital more than NABH, you are free to do that. Align yourself with the insurance company which wants it, and take facility of the TPS to help you to understand how to do that empanelment. Am I right?
Correct.
Huh?
Correct.
My language was all right? Huh? I can keep doing this on your behalf? Okay.
So, Mr. Raji, our question is reduce the burdens, sir. Reduce the burdens. So we are already submitted and get the NABH is a quality conscious.
No.
So that is accreditation.
No, you are absolutely
certified
no.
also.
We are constantly trying to improve in terms of governance issues, in terms of making processes more efficient and effective. You keep giving such suggestions, we will also keep working on it. So you continue giving us suggestions, we'll continue improving in terms of the system. If you don't tell us, we will not improve. So you keep telling us also that why are you burdening us and making us repeat to do things? Why repeated we are doing this? So then we will find out a way. So you keep telling us, we will listen.
And just to add, it is just the certificate copies that we require. Whatever you have submitted to the NABH, it's the same copy that we ask for our documentation purpose. It's not something that you have to reapply for a registration or a fire NOC or any biomedical or pollution control. Whatever statutory documents you have submitted to NABH, it's the same set of documents we will also require. So you just have to share the copies of it. That's it.
Okay.
So one question, sir. I would request MediAssist to please confirm to me. Are you following the 2016 benchmark rates for hospital empanelment also?
Benchmark rates are basically revised from time to time. So I don't know which 2016 benchmark are you referring to?
For Ayush, sir, ministry had recommended guidance rates for Ayush hospitals.
We don't have any benchmark. Which the insurer has asked us to follow.
That is the
same
same
one.
thing.
Yep.
That
Yeah,
is
same.
same.
Okay.
Yes, they are following it.
Okay. Okay.
Do we have any more questions from the participants online? Okay, sir. Throughout this event, we have explored different aspects of health insurance, from awareness and technology to improve importance of data and accessible healthcare. May I now request Professor Bijon Kumar Mishra, sir, Chairman, Core Group of Experts for Insurance at Ministry of Ayush, to share the key takeaway messages. Sir, please.
Thank you. See, कितना हम लोग मेकअप किया है. हम लोग 1 घंटे पीछे जा रहे थे. अब 4 बजा है. 5 मिनट में खत्म करेंगे. What a speed we have done. Wonderful. So a big round of applause to everybody. Wonderful. बहुत ही आप लोग शानदार काम किए. So अभी हम I will just give you 4 takeaways. क्या हंस रहे हो अकेले अकेले यार, हम लोग को भी बताओ. What are you laughing about? Tell us. No, I'm just joking. You also make us laugh because you're laughing on yourself. So friends, I have made 3 recommendations, but you people are free to add or delete. It's not that what I say is final. Okay? Please keep in mind that. And if you agree with me, then give a big round of applause. If you don't agree with me, raise your hand. We'll listen to you. We will amend it accordingly. And then we'll give a round of applause. Okay? So the first recommendation is urgent need to build awareness on Ayush, especially on Unani, to all the insurance companies. To all the insurance companies, there is an urgent need to build awareness because there is still what we all Ayush, but as today we are sitting and had their lunch, I'm saying that we cannot forget Unani. We must have and we must recommend that there is a very low understanding about Unani with the insurance companies as well as some other sciences which are coming under Ayush. So there is an urgent need to build awareness with the insurance companies. That's the first thing. Am I right or wrong? Very good. The second recommendation, we must stress on data keeping to analyze the challenges on Ayush treatment. You see, we must give a good, robust process of data keeping to create evidences, to not allow anybody to tell us that we are not scientific. So we have to work with data in the right manner and make it available with proper documentation so that we are equivalent to all and inferior to none. Agreed? Who said excellent? Acha. Meet me after the program. I had to bribe him. Thank you. Thank you very much. Number 3, Ministry of Ayush to organize. Ministry of Ayush to organize workshops on hands-on documentation in processing empanelment and claims in collaboration with National Insurance Academy, Pune. Okay? Because National Insurance Academy, Pune is supported by the IRDAI and GI Council. So we have to work with them because that's the academic wing of the insurance companies. So we should involve them along with Ministry of Ayush to conduct workshops in a regular manner so that people are nominated from the insurance companies, from the hospitals, and from institutions like National Institute of Unani, Bangalore. Okay, we have to have people nominated from these places and conduct series of workshops throughout the year so that the money spent out of the tax policy makers' money, because all that, don't forget, the insurance companies are contributing to run these academies in the country. And that money the insurance companies are paying out of the money the policy holders are paying to the insurance companies. फंसा दिया हम इंश्योरेंस कंपनीज को. तो हम लोग को ये वर्कशॉप रेगुलरली करना है, बट यू हैव टू राइट ऑफिशियली टू देम एंड टेक इट अप ऑफिशियली सो दैट IRDA कैन आल्सो go ahead and recommend that ये होना चाहिए. Okay? Okay, that's very important. Agreed, everybody? Very, very nice. The fourth one, yeah, please. Nothing to do with the resolution, नहीं?
नहीं, आपने जो workshop कहा ना, that the first workshop happened there.
You see, what I am trying to say, why I have chosen to do it there, you cannot do it because they have trained people.
No, I am offering this place.
Oh, place. नहीं.
Even we can support also.
अरे हैदराबाद में हम बैठा है, हम सबको लाना चाहेंगे, आप चिंता ना करो, आपके इंस्टीट्यूट में लाएंगे सब.
Thank you, sir.
Yes, sir. हम आपके पास भी आएंगे, मत चिंता करो. Yes.
Sir, one takeaway message that the basic people who are involved in documentation in hospitals, not the policymakers or middle level or consultant.
No,
They
तो
are
आप
to be-
decide करोगे ना.
They are to be more sensitized.
So you have to decide
Yes, sir.
that. The hospitals
Yes, sir.
have to decide that. You represent whom?
Yes, sir, exactly.
Who hospital? Acha, you are representing. So you convince the director. Where is the director? You convince the director. किसको किसको करना चाहिए? बहुत पैरवी चलता है वहाँ. आप बोलो.
Okay, sir.
किसको
Thank
करना
you.
चाहिए?
Thank you, sir.
Okay. Okay, the last one, very important one. Let me tell you, very important. Very important. The last one. You know, integrate all the recommendations which has emerged from the last two sensitization programs out of this recommendation which we have made, because many recommendations has taken place in the first two. So I didn't want to repeat that again here. So I'm mentioning this as the fourth recommendation, that all what we have agreed, like a 24/7 helpline number, researching in terms of getting data, in terms of how many people are insured, not insured, all that as number of recommendations have come out of the first two. So we must not forget that. And we keep building, but we keep forgetting. That will not do. So we'll have to also make sure that this merges with the first two.
It's already in pipeline.
No. The again the advisor. That's why he's the advisor. He will always say it's always in the pipeline. I say, when is the tap is going to get open? I want to drink. So I'm just waiting to see. Decision. Now what we want is to make sure that 24/7 helpline is working. Proposal भी move हो चुका है, बोल रहा बा. हम तो खाली wait कर रहे हैं कब हम लोग उसको launch करेंगे. And let people know what is that number which people can call 24/7, to know about Ayush at any point of time. That I want Ayush hospital next to my house. Where do I go? So that helpline is supposed to tell them that. So we have a dedicated helpline number for all streams of Ayush, and to tell all information concerning Ayush in that 24/7 helpline number. Just now advisor said, वो already हो चुका है, होने जा रहा है. Yes, Somashekhar.
That he is the man who created that consumer online thing, 24/7 helpline, which is working excellently. So you you put him as a thing. No, you will not say pipeline again.
That's a good one. That's a good one. Okay, everybody. So thank you very much. I hand over the mic to.
We have already concluded.
Thank you, sir. Thank you for your key messages. This event has not only improved our understanding of health insurance complexity, also made us think about the innovative solutions to meet the changing needs of our community. I kindly request Dr. Muzaffar D.A. Bhatt, sir, Assistant Professor, Department of Medicine, NIUM, to deliver the vote of thanks for the program.
Thank you, ma'am. Respected Chairman, core group of experts for insurance, Ministry of Ayush, Professor Bijan Kumar Mishra, sir. Dr. Kustubha Upadhyay, Advisor Ayurveda, Ministry of Ayush. Dr. Mukul Patel, sir, Gujarat University, Jamnagar. Shri Raju Vasudevan, sir. Director NIM, Professor Abdul Nasir Ansari, sir. Other dignitaries, respected speakers, my colleagues, participants, and the other staff members of NIM Bangalore. A warm good afternoon to one and all. I, Dr. Muzaffaruddin Ahmad Bhatt, deem it an exceptional honor and privilege to propose the vote of thanks on behalf of NIM Bangalore. First and foremost, let's start by giving glory to the as it is rightly said,
Feeling gratitude and not expressing it is like wrapping a present and not giving it. We are immensely grateful to the our sincere thanks to our sincere thanks go to our esteemed speakers for sharing their time, expertise, and experiences with us. Their willingness to impart knowledge and engage with our audience has contributed immensely to the success of this event. An event like this cannot happen overnight. It requires planning and bird's eye for details. The wheels started rolling weeks ago. We have been fortunate enough to be backed by a team of very proactive and dedicated staff of our institution who are well versed in their job. I am short of words to express my gratitude to members of various committees for their involvement and their willingness to do things out of their comfort zones. Here, I would like to mention a few names who put all their efforts in making the event successful. Dr. Tariq Nadeem Khan, HOD, I would also express gratitude to our accounts officer for his meticulous financial management, ensuring the smooth execution of the program. Our sincere thanks to the maintenance staff for their efforts in maintaining the venue and providing a conducive environment for our discussions. Yes, yes. I extend my gratitude to the technical staff for supporting this online session also. I express my gratitude to the PG scholars of this institute for their unwavering support in making this event a success. Last but not least, I extend my gratitude to everyone who has played a part, no matter how small, in making today's event a success. Let's take the inspiration and knowledge we have gained here today and continue to work towards our shared goals. Together, we can make a meaningful impact. I would like to end with these words. Coming together is a beginning. Keeping together is progress. Working together is success. Thank you once again. And I wish you all a safe journey and a wonderful rest of the day. Thank you. Thank you very much.